open comment participants who are watching to please watch and listen to the meeting through the virtual meeting stream that was provided to you in your confirmation email instead of using Channel 8 or YouTube live streams. And that way you'll avoid a delay and your comments will come through live. So Sarah, would you like to tell us about this new platform?
Sure. Good evening, Mayor and members of council. My name is Sarah Huntley. I'm the engagement manager. We have switched to a Zoom webinar platform for tonight's meeting for security reasons. So I just want to alert folks that many people who are participating from the public are participating as attendees, which means you can listen to this entire meeting and watch it if you're using the video link, but you will not be able to participate with your video. You will be able to participate fully through audio when it's your turn to speak. So we have some people who've signed up in advance for open comment tonight, and when we get to that portion of the meeting, which is a couple of agenda items in, the mayor will signal me and I will call on individuals in the order in which they made their names appear on the sign up list for open comment. We have no public hearing tonight, so there will be no members of the public participating in that way. People who are panelists, that's mostly all of our council members and staff members who we are certain are likely to need to speak tonight. You may mute and unmute yourselves and turn your videos on and off. One of the easiest ways to do this is to open your participants box. We also have the chat function disabled this evening. So I believe attendees will not be able to chat, but panelists can chat with me as the host if you need to get a hold of me for some reason without disrupting the meeting. I think that's the basics. This meeting is also being live streamed, as the mayor mentioned, on Channel 8 and YouTube. So if you simply want to be observing the meeting and you don't anticipate having a need to chat, we invite you to watch on those streams as well. But do know that if you try to watch on both, you'll have an awkward delay. Thanks so much.
Great. Thank you, Sarah. And I think I would also add that this meeting is being recorded as well as normal meetings are. Is that correct, Sarah?
It's being recorded through the live stream functionality as we usually record it.
Very good. Thank you. And then I guess the next step here is we need a motion to approve the amended agenda to add items 1A and 1D. So
second.
Very good. Does anyone object?
Can you call out what those are, please, Sam?
Let's see. Let me pull them up.
I've got them, Sam. They're the introduction of our new police chief and a consideration of a motion to approve council rules related to virtual meetings.
Thanks very much.
And who was the second on that?
I was, Mark Wallach.
Thank you.
Very good. And hearing no objection, we're going to say that passes unanimously. And so let's move on to item 1A. Jane?
Thank you so much. This is an exciting night for us because our new police chief, Maris Harold, is with us. Before I introduce Maris, let me please take a few minutes to thank Deputy Chief Carrie Weinheimer. Deputy Chief Weinheimer served as the interim chief of police since September, so for over 7 months, he's been in that role. He's done an amazing job at a difficult time, and in particular, in the last 6 or 7 weeks, he's led our police department through the COVID pandemic response and done an amazing job. Let me also congratulate Deputy Chief Johnson and the other commanders for the great work that they've done, and of course, our police department on the front lines every single day, doing the best for our community. So thanks to all in the police department for the excellent work they've done in the last weeks and in the last months. So now I get to introduce our new police chief, Maris Harold. Maris comes to us having been previously the police chief for the University of Cincinnati in Ohio. And before that, she worked for many years for the university or for the city of Cincinnati. So she brings with her both city experience and college experience, which is great for our community. And among the many things that Maris has done is that she is very focused on community engagement, and particularly with an equity lens. So she's the right person for us at this time. So let me introduce Maris Harold. Maris?
Well, thank you so much. And may I echo the city manager's thankfulness of the Boulder Police Department's administration through these very challenging times. I just want to let you all know how excited I am to be in Boulder. It's a very strange time to start a new position, but I'm excited. I think that I have all the tools in place to really make this a model agency and to really mimic the Boulder reputation across the country and internationally for being innovative and progressive. And most certainly that's been my background, is innovation and bringing police departments into best practices and model policies and procedures, and most certainly community engagement. And so I just want you all to know, from the bottom of my heart, I am just so happy to be here finally. And I look forward to a great relationship with you all.
Well, welcome, Maris, and thank you so much for putting up with the hard transition during this tough time. We look forward to having you here, and we look forward to having your experience with both city and town and gown issues, I would say. And we are very focused on equity issues right now. And so this will be learning for us, and we look forward to learning from you.
Thank you. Thank you very much, Sam. And again, we'll do some great things with the police department, I guarantee it, and with the city of Boulder.
Great. Would any other council members like to speak? I don't see any hands up.
Oh, sorry, I was too slow to do the digital raise hand thing. But if I may, we'll just, Maris, welcome. We're very happy to have you here, as I said before the meeting got started. And I also want to echo Jane's thanks for, I guess, Deputy Chief Weinheimer and the great work that you did as acting chief during this extremely difficult time, and to the whole department. So thanks to everyone.
Okay. Seeing no one else, very good.
Yeah.
Thank you.
I raised my hands. You didn't see me.
Thank you. Not yet. Go ahead, Jimmy.
That's great. Thank you so much, Maris. I just wanted to say it's such a pleasure to meet you, and I can't wait for when all this is over, so that we can meet in person. It's truly an amazing. It's great to meet you.
Well, thank you, and I look forward to working with you and on some very challenging issues. But I am confident we will do some great things, and I look forward to working with you. So thank you.
Very good. Thank you again, Chief Weinheimer, and to the whole force for the work you've been doing through this tough time. And thank you for serving as interim chief as well. It's much appreciated.
Thank you. Thank you a lot.
Okay. With that, I think we'll move on to the COVID briefing.
Yeah, thank you. So the first person to speak will be Susan Motika, who is a representative from our public health department. Jeff Zayak can't be with us this evening, but Susan is the right-hand person, so I think she'll be ready and has a good presentation for us. Susan, can you take it away? You're on mute.
Susan, we're still not hearing you.
Susan, you should be unmuted now.
We're having difficulty unmuting Susan. Bear with me for one moment.
Sarah?
Yes?
The person that you mentioned as Susan Modica is actually Mark Gelband. I saw that earlier as well.
In attendees or in panelists? Susan should be in panelists, so she should be able to unmute herself.
I also saw what Junie saw, which was at some point there was, we had videos and Susan's name came up with Mark Gelband's image. So maybe she's somehow on the wrong screen. I don't know how that works. Susan, maybe log off and log back on.
And I'll also note that the chat is working.
Could we switch the order?
I think we could. Chris, can you go move forward to? Oh, yeah. Why don't we, no offense, Rob, but let's maybe skip Rob and do the first city presentation. So we'll start off with a city update. The people that will be speaking tonight are not only me, I'll be at the end, but Carl Castillo, our Chief Policy Advisor, and Kurt Fernhaber, our Housing and Human Services Director. But before we even do that, Sam Weaver, our mayor, was on a call with other mayors and the governor this afternoon right before this meeting. And we have arranged that Sam will start off by telling us what he's learned from the governor. So Sam, can you do that now?
Yes, I'll do that. Thank you very much. Chris Meschuk, if you could go to slide 3 of Carl's presentation. I think that has some, next one. Yeah, there you go. So as we heard yesterday, the governor changed the executive stay-at-home order to a safer-at-home order. And he did this based on a whole bunch of epidemiology, the modeling that they've been doing. There are several people who are experts at this who work at the University of Colorado and study epidemiology. And they look at the interaction of 4 different variables. So they're looking at social distancing, they're looking at volunteer population doing extra social distancing. They look at the wearing of masks, and they look at testing, surveillance, and tracking. So those are the 4 kind of buckets that they tend to look at. And they've been looking at each of those buckets. If they do kind of extreme levels of those, what does that mean for the number of ICU beds that we will need and the number of ventilators that we'll need? And the conclusion that they came to after a pretty good amount of work, and there's a nice paper out about this, is that any one of these is not good enough. So even if you go to the extreme and you have 100% of people doing social distancing, that alone isn't good enough. Same with any of the other techniques. And so where they've landed is that we need to do a combination of the 4 of those things. And so it's the level of the combination that you do that can keep you below saturating the number of intensive care beds that are needed in the state. And so part of the work that they use to decide to move from stay at home, which is the really high level of social distancing, to safer at home, which is a slightly lower level of social distancing, includes other components to it as well. And so what we may have heard yesterday on the news is that Governor Polis had lifted the stay-at-home order. That is true, but he replaced it with something called safer at home. And some of the components of safer at home are you should stay at home unless you need to. So in other words, it's not just necessities like the pharmacy and the grocery store. If you need to go pick up a meal or you need to go visit someone, you're going to maintain social distance, but it's voluntary. The request here is to be as responsible as an individual as you can. So it's not a stay-at-home order, but it's recommended to maximize your time at home and go out only really when you need to, or when it's an elective thing, but it's an elective thing that you do rarely. So the other components of that are vulnerable populations need to maintain the stay-at-home order. So the elderly, people with underlying medical conditions and so on need to stay at home. Everyone needs to wear masks. So when you're in a situation where you may encounter other people, masks are really important, and masks are to protect other people from your potential COVID infection, because it turns out that they're learning that 40 to 45% of people who have COVID are asymptomatic. And so they're infectious, but they're asymptomatic. And then testing and tracking is not where we need to be yet, but the state is working really hard at ramping that up. And so the basis for which the governor made this change from stay at home to safer at home was based on this work that they've been doing, this modeling work and the epidemiology. So what does the order mean? And the way the governor summarized it this afternoon is what the executive order did, and I'm not sure the order is fully out yet, but the goal of safer at home is to describe what is being changed. But what has not been described is how it's going to be implemented. And what he means by that, I believe, is that there will be public health orders that are going to be coming out in the future. And those public health orders are going to pertain to different kinds of businesses in particular. So this change to safer at home means that there's going to be some relaxation of the restriction on businesses. And so the way it was described on the call, and don't hold me to this, but on April 27th, next Monday, is when this change is going to go into place. And the change is not everything all at once. So on April 27th, one of the things that's going to open up is curbside retail. And so that's something that is expected to happen, and it will follow kind of the way that pickup, food pickup has been done, where everyone wears masks, the people handling the bags or the products are wearing gloves, and it's handed from the curb to the car. And then during the week of the 27th, these additional health orders will be rolled out. And there's 3 areas of business that they're kind of in different segments. One of them is retail. One of them is personal services, like having a haircut. One of them is office work. And the understanding I have is that during the week of the 27th, the rules for personal services of different kinds will be rolled out. So there's nail salons, there's haircutting, there's estheticians, you know, there's a whole range of different personal services. And there's an attempt to work with the professional organizations that represent those different personal services to come up with what the best practices will be, including mask wearing and distancing. And in some cases, you can't social distance, right? And getting a hair treatment, you're not going to be able to be 6 feet away. And so they're working through defining those health orders. The only other date that I really have down here is that on May 4th, the goal is to have the rules for non-essential businesses like office work. You know, the goal is to maximize telecommuting, but for those who need to be in an office for some reason, what are the protocols for doing so? And I'm sure that there are subcategories to that as well. I believe that the goal on May 4th is also to have in-store retail sales. So much like grocery stores have ways in which they meter people going in and out, and they have different ways of making sure that social distance is maintained by markings on the floor and so on. I believe in May 4th, the goal is to be able to have retail stores able to have customers enter rather than simply being curbside. So that was what I picked up as far as the dates and kind of the general picture. One of the things that it means to us differently is what the governor mentioned was during stay at home, the focus was not on enforcement, it was on education. And the goal was to make sure that people understood the reason for social distancing, the reason for mask wearing. The goal of the police was to make sure that that education happened. What the governor said now is they expect more enforcement around the business practices. So he said that's up to each city to decide what that looks like and how it's going to work. But if there's a systemic lack of social distancing in particular businesses, he feels like there needs to be some kind of consequence to that. So he didn't elaborate on that. He did say it was totally a municipal decision. So it's something that we will need to talk about as we go forward with this order. And that's much of what I gathered. The one other thing that they highlighted for us is that there's a tool. They're working with Google, one of the Google subdivisions is working with the Department of Local Affairs, Department of Natural Resources to develop a tool which quantifies where people are congregating. So in parks, at trailheads, on trails, the governor emphasized if you're not maintaining social distancing, this order is not going to be effective. And so there's going to be a digital tool that cities will be able to access that will help us quantify where it is that people are congregating and maybe not maintaining social distancing. So at the end of the day, he really emphasized personal responsibility. He emphasized that this is a work in progress. It is not done yet. These public health orders that will be coming out will be kind of the defining, practices that each type of business is supposed to follow. So at the end of the day, that's what I took from that. There's a lot to be determined as we go forward. But, stay tuned.
So Sam, let's see if Susan Motika from Public Health can start off at the beginning, and then maybe there'll be questions about what you've said and what she said. Susan, are you able to get on now?
We're still having difficulty bringing her back into the meeting, Jane. I'm trying one more thing and then she may have to call in.
Okay, so then why don't we go back to the first city slide? Great. And from there, I'll ask Carl Castillo to make the presentation to follow what Sam just said. So Carl, are you available?
Yeah, can you all hear me okay?
Yeah, thanks.
Okay, great. Good evening, everyone. The only thing I'll say to follow up on what Sam said was that the governor is thinking of this as what is more sustainable. So where we've been up till now is just not something that we can sustain. So that's another concept other than individual responsibility that he really focused on. He also did mention that local governments have the ability to be more stringent. And in fact, Denver will continue to have their stay-at-home order in place until the end of April. And local governments can also be less strict. They can ask for variances, and the state will consider those based on public health data. So yeah, if Chris, if you can move to the next slide. So backing up here, wanted to really quickly run down, you're having many pieces of federal legislation passed. So I'm just going to give you a really quick rundown of what we've already seen. We, of course, back in earlier part of March, had the first package. We call it COVID-1. It's specifically named the Coronavirus Preparedness and Response Act. That provided mostly funding for public health expenses like the CDC and some increased administrative costs for the SBA. COVID-2, the Family's First Coronavirus Response Act, passed on March 18th, provided sick leave, tax credits, free COVID-19 testing, expanded food assistance and unemployment benefits, and increased Medicaid funding. And if you can go to the next slide, or actually no, stay on that slide, I'm sorry. The The COVID-3 package was the CARES Act, which was the big one, the 2.3 trillion. And that provided a lot of funds for individuals in the forms of cash payments, extra unemployment benefits, extended tax filing deadlines. For small businesses, it provided emergency grants, forgivable loans. And for cities and counties and states, it provided $339.8 billion in what is known as the Coronavirus Relief Fund. And this is what I really wanted to brief council on. Of this amount, 560 million is being directly allocated to Denver, Adams County, Arapahoe County, Jefferson County, and El Paso County. Those being the 5 local governments in Colorado that have populations of over 500,000. This money will be directly allocated to them by the end of the week. The state will receive $1.68 billion, and there's no clear direction on how the state is to use that, much less on whether they should be sharing it with smaller local governments, including the city of Boulder. What we do know is that it is limited for necessary expenditures incurred due to the COVID-19 crisis and ones that were not accounted for in the budget. We are waiting for guidance from Treasury Secretary Mnuchin. That was due earlier this week. We're hoping that his interpretation and the guidance allows it to be used more flexibly than we currently read it. So that is something that's in place. And if we can go to the next slide. So that brings us to today, which, as you know, there was a bill that was passed by the Senate. It was it's called the Paycheck Protection Program and Health Care Enhancement Act. It provides $484 billion for small businesses, $320 billion for the payroll protection program, with $60 billion of that for restricted for smaller institutions. And they make that evaluation based on the value of the assets of the company. Also, $10 billion for loans and EIDL loans and for EIDL advanced grants. $75 billion will go to hospitals and $25 billion for testing. Significantly, no new money is going to local governments. You see on the slide that we indicate that it may allow for the Coronavirus Relief Fund to be used for lost revenue. It turns out that was not included, unfortunately. So we do not have that additional flexibility that we were hoping for. We're still having to rely on the Treasury Secretary for that interpretation. What we did get, however, is a commitment from the president to support the next bill that would include a variety of, it would be like a really big stimulus bill that would address infrastructure needs. He has committed in a tweet, no less, to ensure that it includes funding for local governments, cities and counties of smaller than 500,000 population size. So one more thing I'll say. On the call today, I did join the mayor in the call with the governor this afternoon. And both the governor and his chief of staff were very encouraged and very optimistic that there would in fact be this this next bill. So if we could turn, actually on the same slide, we have that, what I'm calling COVID-5 is the big bill that we're expecting to yet, that has yet to come, but we're expecting to come forward. What we have requested, and we have put this in a letter to our congressional delegation that we sent yesterday, is to make sure that it does in fact provide this direct, flexible funding for local governments to help us stabilize, and that would be funding that could be used for offsetting our revenue losses as well as for additional expenses for COVID-19 expenses. Funding for housing and to support homeless. Increase money for small businesses, additional direct funding for households, access to health coverage for COVID patients, and the big one, I guess, would be the funding for transportation infrastructure. So with that, if you can go to the next slide. Okay, so Sam just spoke about the stay-at-home order, so I will not reiterate anything there. So the question now becomes, does the state of Colorado decide to suballocate any of the funds that they receive? On the call today, the governor reiterated a message that we've heard loud and clear from his administration that whereas no decision has been made on whether any of that funding will be shared with the cities and counties, they are committed to, well, they've said that they have not made a decision, but they are committed to focusing on increasing the amount of money that is available by lobbying the federal government for more funding. So not a clear answer. What I can tell you is that we did send a letter to the governor requesting these funds. I did share that with council late last evening. So we also met with our state legislative delegation, and in that meeting, we made an appeal for their support. And the reason that's significant is because it's not clear that the governor will be able to make this decision on his own. In fact, today he's indicated that he will need to have a discussion with the JBC. It could very well be that the General Assembly needs to concur, if not even, and perhaps even appropriate money from this coronavirus relief fund. So we continue to try to urge the governor and to urge the General Assembly to consider a local government. It's not enough for us to rely on a promise that the federal government may yet pass another federal bill. That is uncertain. We'd like there to be a commitment that this funding will be used for the local governments, and that if in the future there is new money, fantastic. At that point, we can address that issue. We can certainly have money distributed on a contingent basis. So that's the message we've been conveying, and that's perhaps the biggest takeaway that I want council to have from this briefing. Lastly, if you can move to the next slide, just a quick update on the General Assembly. As you know, they have not been meeting for quite a while. The JBC does resume working on May 5th. And they and the Office of State Planning and Budget will be presenting a fiscal forecast on March 12th.
Carl, not to interrupt, can you say what the JBC is?
Yeah, the Joint Budget Committee. It's a committee of both the House and the Senate, and they are the ones that are charged to come up with all appropriations and to develop a fiscal forecast. So they are anticipating approximately a $3 billion decrease in the revenues that will be available for them in this next fiscal year 2020 to 2021, which begins this July 1st. So a substantial amount of money, of course. The full legislature then will convene on May 18th, and they will have 53 days remaining, and they will have to decide how they're going to use those days. The one thing we know that they are constitutionally required to pass the budget, which is known as the long bill, the budget orbitals, which are related bills, and the School Finance Act. So that's one thing we can expect them to do in the last week or two of May. The question then becomes, of the hundreds of pending bills that they still have before them, is will they be able to consider any of them? The standard by which these will be considered, as described by the speaker, is 3 criteria. Are they free, are they fast, and are they friendly? By free, that means, are they going to have a fiscal cost? If so, that's going to make it pretty much impossible right there. The state's not going to be in a position to incur new costs. Are they going to be fast? In other words, are they going to require a lot of deliberations and amendments? If so, again, that's probably not something they're going to focus on. And are they friendly? By that, they mean, are they likely to have bipartisan support and at the very least not opposition from industry, from other special interest groups? And I guess another one that I will add is, will any bill that is going to be considered will have to be deemed to have some sort of helpful relevance to the pandemic era that we are in. So we have, for example, a couple of mobile home bills that we're really focusing on. We believe that housing stability is now more relevant than ever. So we will be making the case that those are bills that meet these criteria and should be considered. And the last thing, as I said, they will have to decide whether to support any decision that the governor has recommended on how to use this $1.7 billion that they have. And they may, in fact, have an appropriation that's required. So that is all I have. I'm happy to take any questions.
And if there are no questions for Carl, we do know that Susan is on the call now, so we can move to public health. Carl, stay on for later questions.
Thank you, Jane. Can you hear me now?
Yes.
Wonderful. Okay. Thank you all. Thank you for your patience. Jeff Zack would have been with you all tonight for his regular briefing, but he had to give two other city council presentations, one in Lafayette and one in Longmont. So he asked me to make this one today. Could we get the next slide? So you can see our case counts at 365 in Boulder County, the hospitalizations, those have recovered, the growth rate. You can see that 23% of cases are from long-term care facilities and that roughly 85% of deaths are from long-term care facilities. A promising statistic is our growth rate. It's still between 1.5% and 3%. So this is relatively low, but still growing slowly. Next slide, please. So this is a slide that is dealing with residents who've tested positive or considered probable by Boulder County municipality. And this is calculated based on the rate, not on the count. For example, the rate in the city of Boulder is 139.7 per 100,000 people. I would also note that it's been asked before, the definition of probable cases are cases of individuals who are determined as likely to have or have had COVID-19 using both epidemiological and clinical criteria. You may have heard the governor repeat the statistics. Colorado has 10,000 reported cases. However, the state believes the real number is closer to 65,000 to 75,000 Coloradans. Next slide, please. So next, we're looking at Boulder County residents who have tested positive or considered probable, displayed by age groups. And you'll see what those three largest categories are: 20 to 29, 50 to 59, and 60 to 69. And we know that older people are facing increased risks and a harder experience with the virus and more likelihood of death. The epidemiologist who I worked with on this said the numbers for 20 to 29 she thinks may be attributable to the influx of cases early on when CU was still in session. Next slide, please. Next, we're looking at the source of transmission among Boulder County residents. You can see early on that there was travel and limited person to person. As the slides proceed, you can see it is community-based transmission at this point. And we want you to note that 23.1% are long-term care facility residents or staff. Could we go to the next slide, please? So this slide is interesting from an equity perspective. And I think there's many takeaways, and Emily Payne, our epidemiologist working on this, is going to have a deeper briefing on this. So stay tuned in a future briefing for much more unpacking of these numbers and what it means. But just two takeaways for tonight. The fact that the Latinx population has 28% cases, this is double their percentage of the population in Boulder County. And obviously they're 14% of the population and have 28% of cases. Here's another fact. Over 1/3 of people hospitalized are Latinx. And this number is triple their percentage in the overall population of Boulder County. So I could imagine we're asking ourselves, and you would want to know, what are we going to do about this? What is next? So here's some ideas and sort of planning notions that we have, because we have to take action on this. As you may have heard the governor talk about Webb Brown at the state, really initiating a working group on this, because this is a finding that's not just in Boulder County, it's across the state, and it merits a systemic solution. So we'll be working with them. We need to think more about prevention of chronic disease in Boulder County. Prevention of chronic disease is really critical. We know the Latinx community has this in higher numbers. And as I said before, we know that people with chronic disease experience the virus with more severe symptoms. Jeff and I also talked today about Boulder County programs and how we can look at county and Boulder County public health programs serving clients and how we can better serve them and be more responsive to the aftermath of the virus. That's going to be really critical on many economic and social justice fronts. And then not lastly, we need to listen to our community, work with cultural brokers, and follow their leadership. Also, translation of materials, increased translation and public education on materials. Next slide. The next slide is the 3-day average growth in the number of Boulder County residents with confirmed or probable COVID-19 cases. So this is modeling is showing that the stay-at-home order has reduced social interactions by 75 to 80%, and that our 3-day average case rate continues to decrease, meaning that these, pretty severe orders are working. Next slide, please. This is a slide showing all of the metro area counties and their hospitalizations. So even with the top number, that's Denver at the very top, and Boulder is the red that is the 4th from the bottom. What is interesting and important to see here is a stabilizing, a continued steady slowing of hospitalizations here. Next slide, please. So this is kind of our stoplight system on hospital resources. And this data originates from Emergency Management Resource, an emergency management database populated daily by our 5 local hospitals. There are 5 in Boulder County. So this is a summary page that shows counts for critical care and non-critical care ventilators out of the total available. And you can also see counts of medical surge and ICU beds available out of the total reported capacity in the county. So the slides towards the right are the percentages of medical surge, and ICU bed shortages. And this shows the percentage of the 5 hospitals reporting an expected shortage of supply this week. And then at the very far right, we've got the personal protective equipment supply, showing the percentage of 5 Boulder County hospitals currently reporting sufficient PPE supply for the next week. So we have just recently, as we say in emergency management, stood this up, and would look forward to feedback and improvements as we're refining this. So what I'd like to do is shift to the discussion about the orders, if that would be okay right now. And if I repeat things that Mayor Weaver covered, feel free to just engage, because we did have that little technical difficulty in the beginning. Is that okay?
Yes.
All right. So the public health directors in the metro area really looked at national best practices and studies, and looked at many of them and said, what are some of the key criteria we need to look at for reopening and considering a relaxation of the orders? And one is, of course, testing, and Colorado and Boulder County are very short on testing. The other is containment, the issue of contact tracing, voluntary quarantine and isolation, and to do that really well, to trace people that have come into contact with this disease. You need people, you need boots on the grounds, and we do not have enough people performing this function, either in Boulder County or in the state of Colorado. Another best practice indicator is a 14-day steady decrease in cases. And we haven't seen that. We're seeing stabilization, but that steady decrease in cases, we haven't seen yet either. We know that masking is critically important. Next slide, please. So I think Mayor Weaver probably went over a number of these issues, but you can see that the governor has really shifted to this safer at home. The first phase being stay at home, the second phase being safer at home, with an understanding that a combination, excuse me, let me just, that a combination of factors are going to serve us very well, going to serve the best chance of keeping the disease from increasing in a way that the ICU beds are overextended. And that is the critical criteria here. So in these modeling scenarios, scenario F was really favored. So this was maintaining a sustainable level of social distancing, promoting mask wearing, pursuing aggressive case detection containment, and recommending that older adults maintain a high level of social distancing. So Jeff Zach was involved, and we have been in many discussions with the Metro directors, with CDPHE, with the governor's office, just happening in the last few days. And I think that we are still looking for this notion of what, as you see in these slides, what does strict precautions and protections mean? Like it says, critical businesses open with strict precautions. We're looking forward to guidance from the state about that. We have some indications, and many of us who have been on the calls have heard some indications, some inclinations, but we actually need to see the order. We have heard it may be the end of this week, or it may even be early next week that the governor will issue an order on this. Jeff reported that the governor will be convening a restaurant working group, and this will, excuse me, just looking at my notes, that this will be the governor's office. CDPHE director will set out a process for who will be involved, and that this group will really collect guidance, because the curbside service and the deliveries will continue. How things reopen with the restaurants and how that social distancing will work will be part of a working group making recommendations on this. We've had some questions. Next slide, please. We've had some questions going back and forth among the Metro directors. Okay, if we're moving out of phase 1, how long does phase 2 look like? What we heard on the call with the governor was some weeks, perhaps into June. I think it's really going to depend on the case counts and how the second phase of social distancing goes. So I emphasized before that criteria in the beginning. A Harvard study that Jeff has been citing has really talked about the need for 150 tests per 100,000 people, and that Colorado currently has 29 per 100,000 people. So we really need to step up those efforts, and a lot is happening on the testing front. The next time we report, we'll have much clearer information on this. I mentioned the strong workforce needs, And I think that Jeff and the Metro directors are really evaluating what can we do to beef up both the testing, the workforce, that the containment issue in the next couple of weeks while we're waiting for the governor's orders and for the relaxation of these orders. So there's questions about whether Metro directors could extend the orders, the original stay-at-home order, whether there would be a relaxation that would vary from the state. All of that is under discussion at this point. One thing that Mike Chard, our director of the Office of Emergency Management, discussed today on the administrator call was a data collection system, basically an early surveillance system that would involve a survey. It would involve data collection from existing sources. It would gather 911 data, but it would pull data from various systems to help us use an early surveillance system, perhaps as a proxy for the kind of in-depth testing that we really need. So I think that if we could go to the next slide, you can see what these categories are. And I think that in my conversations with the county attorney today, they were very, and Jeff was as well, we just need to see the order. It's very hard to make predictions. I think that having as much collaboration, cooperation, so that our residents are not having to deal with disjointed or contradictory instructions is still paramount. But obviously, the virus has shown up in different ways depending on which county you're in. So we'll just have to look really closely and work together very closely as this order emerges. So that's about all I've got right now.
So I guess I would ask if there are any questions for Susan. You can either use your raise hand, or I guess if we get rid of the presentation, we can go back to
Sam, I can't find the raise hand button today. So
just so people know,
I printed something. I'm just going to hold it up if that's okay.
Okay.
My hand is raised, and then the audience will know too, and I'm just going to do that. So
okay, that's fine.
I do have a couple questions, but are we just asking? Is Dr. Vissers also going to give a presentation?
Yes, Dr. Vissers is scheduled to give a presentation. So if you'd like him to go now and hold your questions, or you can ask questions now.
Okay, so I do have a couple that I think are probably relevant to this. So my first is, I know that the governor gave some clarifying guidance and information on long-term healthcare facilities, but we're getting emails pretty routinely saying there's a new outbreak here, there's a case here. So I just wanted to make sure that is there somewhere that we can track and see where there are cases and whether we need to take further steps if somebody alerts us? So that's one. Number two, there was some confusion, I know previously, about if someone had a roommate who was infected, what the protocols were, and some people were being kept in rooms with positive diagnosis roommates. And so what's the thumbs up?
Sorry, that's to, go ahead.
Maybe you just appreciated what I was saying. I don't know.
Right, yeah.
Anyhow, so people were in rooms where one person was healthy and the other person was infected, and then like staff would come in and, full gear, and the other person was sort of a sitting duck. So I wanted to hear about what's going on there. And then also, are there, like, for people in long-term care facilities, that's where so many of the deaths are coming from, and I think you said 23% of the cases are emanating from, is there a requirement that they get, temperature and O2 checks daily or anything like that? That's kind of my first question. I'll pause.
Would you like me? I'll address those as best as I can right now. So the first is the governor's orders on long-term care. We are studying that. We have a a team that is working very hard with long-term care facilities. I was on the phone with the state of Colorado with their health facilities division, really talking about the guidance and the support that they can provide as well. We're looking at testing and having ongoing meetings and checks with long-term care facilities. To answer your last question, the guidance from CMS in nursing facilities is that there really should be isolation, and there should be a moving of people who are not infected from people who are infected. So that, that's the guidance we've seen on the long-term care facilities. And then the temperature, and there's a whole set of protocols, and I can send you these from the state of Colorado. I don't have them all memorized, but they are routine checks that are from the Health Facilities Division at CDPHE, and the kind of protocol that must be conducted on surveillance of resident symptoms. So I'd be happy to send you that.
Sure. And are those specific to COVID or just generally?
I believe they are. I saw a sheet that was specific to COVID, so I could send you that.
Okay, great. And then in terms of sort of shifting to stay at home, I think I'm hearing you say we need to see the orders, and we don't know exactly what that's going to look like yet. I have a couple concerns. One, with the severe disproportionate percentages for our Latinx population, will we be looking at anything when we transition into phase 2 that will heighten protections? I don't know what that could look like, but obviously we are doing something wrong and not protecting people well enough. So is that something even outside of the governor's order that we may need to be more restrictive on?
Yeah, it's interesting you mentioned that. One of the things we were talking about today as I was really thinking through that equity questions that are very understandable, we need to act, but really being vigilant about the face masks, the PPE. If we think about Latinx population in retail or client serving situations, the masking is absolutely vital. So I think that is a short-term thing. And the more we're learning about masking, and I should have emphasized that more, it's really a two-way transmission, but it's to prevent people from getting ill if we may be a carrier who are asymptomatic, basically. So I think looking at the masking and personal protective equipment of those workers would be vital.
Okay, thanks for that. And then I guess just again, as we're transitioning, and Sam, you mentioned that it was going to come down to more enforcement now, and that sets off some red flags for me that, when we're enforcing, we can do that in a biased manner. Also, enforcement might be targeted at people who are obviously public facing, and there may be certain jobs that get targeted more. So I would just want us to be very thoughtful in how we go about enforcing. I don't love it that it's coming to that. And I think it would also be helpful to know whether we're going to take a more cautious approach than statewide. That's all I got for now. Thanks.
So can I jump in for a second and address the last point that Rachel raised, which is about equitable enforcement. So as you know, Rachel, we're very well involved with the National League of Cities, and they are going to be putting on a webinar that we'll be listening in on to understand how we can make sure that our enforcement efforts are putting issues of equity first. So we are definitely having that in mind and going to we're getting some training with regard to that to make sure that we're focused on it. So I just wanted you to know that is something we are doing. You're welcome.
And I think it's also community, like, a lot of the complaints that we're getting are about landscapers as an example. And I think that's, could be some bias in targeting there. So if it's coming down to enforcement, I just think we need to be super mindful. Thanks, Jane.
Sure.
Great. And just to emphasize, make sure that I put the correct context around enforcement, he was specifically talking about businesses. and the way that behavior is in businesses, whether people are wearing the proper equipment, whether there is a method within the business to create social distancing. So I've been in one grocery store that did a good job at that and another that did a poor job. And so I think we do need to be mindful of what you mentioned, but he was not talking about necessarily anything except for making sure that businesses are, I'm sure education is first, but once educated, then how to make sure that once the education has been done, that if they're being non-compliant willfully, that there be some steps taken to try and bring them into line. So I have four hands up. I have Bob, Aaron, Mark, and Mary. Sorry, I didn't see you right away, getting used to the new equipment. So Bob.
Susan, thanks for that presentation. I have two questions. I'll ask them both now, and then I'll turn off and let you answer them. First, in your presentation, you referred to the difference between people contracting the virus through travel versus community versus person to person. So I'd appreciate if you could distinguish or tell us what the difference between community contagion is and person to person contagion. And the second question is, you and others have referred to a percentage of physical distancing. I'm trying to understand what that means. Does that mean that the percentage of the population that's engaging in physical distancing? So if we say 75% physical distancing, does that mean 75% of the people are physically distancing at 6 feet and 25% are not? Or what do those percentages mean when you're referring to physical distancing? Those are my two questions.
Yes, on the answer to your second question, 75% are physically distancing. That is correct. So when we hear about 70 to 75% are physically distancing in the stay-at-home orders, and we're considering dropping down to 60 to 65, that means that 70 to 75% are doing it, and there are other people that are in the workforce that are critical workers that are not able to do that. So you're correct in that analysis on two. On that issue of the travel versus the community versus person to person, when we were first, and I'm going to say what I know, and then I'm going to be happy to get a more fine-tuned question answered to you from an epidemiologist. But the first incidents of cases that we saw was really due to travel, people who had traveled to affected communities and brought back the disease. And we were able to use that contact tracing method to find this out. So we've been using contact tracing really through this whole period, but really found that as this tracing was not able to identify the source of how somebody could have contracted that, that's where we call that community transmission. So if there is something that I need to parse out or define a little bit better than that on the person to person or the community transmission, you don't know where the source was, but it came from the community. But I'm happy to get you an EPI's take on your question, if that'd be helpful.
Okay, great. Thank you for that. Next, I have Aaron, then Mark, and then Mary.
Susan, thanks so much. That's a very helpful presentation. So you led off by talking about how we still don't have the testing levels that we need, and we don't have the people power for the contact tracing yet, and that we haven't seen yet that 14-day decline in cases locally here. So given that, I'm wondering to what extent the County Public Health Department is thinking about maintaining a different stay-at-home order from the governor's, like perhaps going back to the previous one that was issued before the governor issued his. And I heard you address that a little bit, but the timing was unclear because it sounds like the new approach is going into effect on Monday. So I'm just wondering, like, how are you going to be able to get ahead of that if you are going to consider maintaining stricter rules here in Boulder County?
Mm-hmm. So I think that if you look if you look at the governor's scenarios, and let me just look at my slides for another second, please. So I think that what they are relying on is this achieving the 60 to 65% social distancing, physical distancing, by encouraging people to stay at home except when necessary, that the primacy of masking in public, the no gatherings over 10 people, and that sick people may not go to work, and avoiding unnecessary travel. Those are really the indicia of what is thought to be a successful path for keeping those ICU beds not overrun. I think that we are going to look at the order and going to consider some options that may involve, it could involve an extension of the existing stay-at-home order, could involve other modifications or approaches. I think that having our employees and really looking at the telecommuting and the governor's order, or his guidance, if you will, that he gave us in the press conference yesterday and in calls today, is really talking about the telecommuting and really thinking about which sectors of our population really need to telecommute because of a higher risk factor, and really moving our society, at least for the short term, towards much, much more telecommuting. So we're just going to have to see. I mean, I can't answer, I can just kind of restate what our options would be again, and that we're going to need to look very, very closely at how cases increase, if they do, or if they plateau, or if they decline, as to what kinds of other enforcement may be needed, because I think the governor really foreshadowed that the data has to drive this, and there may be relaxation and then additional enforcement if cases spike. I don't think anybody wants to see that, which is why being really thoughtful and careful at the outset makes a lot of sense. So that's what I would say.
Thanks for that. I guess we'll just wait to hear back from your department about your thoughts on the next steps.
Yep.
Thanks.
So Aaron, if I could just say something that I heard on the call today. The governor said that April 27th doesn't mean anything can necessarily open for business. He said, we'll see how the week goes, but it could be that on April 27th, people at, say, a hair salon can go in and begin preparing their business to receive customers. And once the guidelines for hair salons are out, the public health order, then they can open for business. So I think there's still a TBD about that. Monday is when the stay-at-home order is lifted. And so for a lot of people, individuals, that has maybe immediate effect, but for businesses, it's not clear what it means yet. So there's still that uncertainty as well. Next, I have Mark.
Susan, thank you for that presentation. It was very helpful. My questions, I have a couple of questions surrounding testing. Are we tracking any data to determine whether the testing in the Latinx community is at a disparity to testing in the rest of the community? And given the results that we're seeing, should we not be tracking that? And my second question, I'll do them both at once, is you referenced the COVID tracking project out of Harvard. And looking at that, it appears that Colorado's incidence of testing ranks about 42nd among the states. And my question there is, how did we get in a position to be so deficient in our testing patterns? And what are the kinds of strategies that we can use to improve that performance?
Those are both questions that a lot of people in the state are asking right now. And I would just say that we're in a period of working closely with the state to shore up testing, both a methodology for it, addressing priority populations, as you suggest, and getting the much needed supplies. We've heard there's been a loosening of some of the suppliers, and that we're going to have some better results on the supply side. And as to your tracking and the methodology of the Harvard study, I would just, that is really a policy question that relates to public health funding and the decline of public health funding. It's a very complex question, but I would be delighted to get you an answer on that before public health comes back to City Council for a briefing, because it's really critical. And the next week, we're going to have a lot more information. So I'd be happy to furnish an answer in writing.
I appreciate it, and I look forward to hearing from you again.
All right.
Great. Give me a moment. I lost my window. I have Mary next.
Susan, thank you very much for that and for helping Jeff out. I have a question kind of similar to the one that Mark just asked in terms of the testing and how that might be used, or the criteria for testing, how that may be used as a strategy for improving some of the disparities that we're seeing in the disaggregated data that we saw. So that's part A, and then part B, what other things can be incorporated in the short term to kind of try and address that? For example, it seems to me that something like paid sick leave going hand in hand with more testing of that particular population might be ways that could improve in the short term. And of course, in the long term, you mentioned the systemic issues. So that's my first question.
I'm glad you brought up that very important policy issue about paid sick leave. I think that we're going to need to look back. There was an excellent presentation on the state legislative forecast, both the JBC and the legislature that I listened to. And I think that being able to link paid sick leave, family leave act, is absolutely vital. Some form of these things being very important policy actions for the state legislature and for our municipalities. And I've been tracking some of the federal, there's been the fourth stimulus now. We may be getting into a fifth, as you heard. But some of those economic justice provisions that were embedded in some of those stimulus packages, really studying those and unpacking those and seeing what we can get out of those, I think is really important. So, action at the local, state, and the federal arena on that. Your question B, Mary. As to your first question, I think, we are very, very concerned, very worried about the criteria for testing and how we can be supportive of the Latinx population. And I would just fold some of these responses into the earlier question about testing and get more, get a more detailed answer on that in the written response that I'm going to provide on the previous question.
Thank you. My second question has to do with, you mentioned that the governor was going to put together a working group to address the restaurant recommendations. And so, again, that may be a place where some of the short-term strategies could be addressed. But I also was wondering if you have any idea what the makeup of the working group will be.
No, I don't have any idea, but again, that's something we can update you and Boulder County about. That would be something a lot of people would be interested in. It should be a thoughtful, diverse group, and we just don't know. We heard about that it's going to be established. We don't know who's going to be on it, but we'll be tracking that closely because we get so many questions from businesses that are restaurants. This is something that's a vital concern. And then the community concern you raise as well with the workers. So we'll just update you on that. Jeff didn't know any more than I've told you.
And thank you for that. And just to say that if you get the opportunity to make any recommendations that folks that have could represent that community would be, I think, very essential here in order to help address some of these disparities in the short term.
Absolutely.
Thank you.
Great. Any other questions for Susan? Thank you very much, Susan. That was very helpful.
You're welcome.
So Sam, our next presenter is Dr. Vissers from Boulder Community Health. And I apologize to Dr. Vissers because he's been on the line for a long time, but it's your turn.
Thank you. I'll try and keep it brief. First, I'll give you an update on what's going on in the hospital. We have 8 positives that we're caring for, 5 in the ICU, and I think a total of 9 rule outs, although that may be less now. So we continue to be anywhere from 10 to 20 positive patients and rule outs. The rule out number varies a lot with testing, so how quickly we can get the test back. We have seen a bit of an increase since last week in some of our inpatients. Almost all these patients are coming from long-term facilities. Jeff Zayak and I were in communication throughout the weekend. We have some concerns about small outbreaks, not a tremendous surge, but concerning nonetheless. I will say overall across Colorado, probably the best marker of how we're doing in terms of COVID in the greater population is inpatient. So again, this goes back to testing. The only people really being tested are healthcare workers, pre-hospital providers, police, fire, and those that are admitted or sick enough to be admitted. Over the last about 7 to 10 days, we see a continuous decline in total numbers of beds being occupied by COVID positive patients. And as you recall, first you'll see a decline in the population, then the admitted patients, then the ICU patients, then vented, and then the last to drop just because it takes 3 weeks are the inpatient deaths, which has mostly leveled. So we still have only had 3 deaths at our facility, and 2 came in as comfort care. And so we've only had 1 vented death so far, and our mortality rate for the ventilator patients is about 25%, which is pretty good. Most of the international national data is around 65% or so. So unfortunately, if you get on a vent, your chance of dying is about 2 out of 3, at least nationally. But there have been some changes in the management, or it could just be the small numbers. But so far, we feel very fortunate in terms of how we're doing. I would like to emphasize a few things about the testing and the challenges that we face. So as we expand and we want to answer questions like, why is the Latinx community appear to be affected more? It's incredibly difficult to make those interpretations when we're only testing a very select population. And so right now, most of our tests are either healthcare workers or admitted patients. So you could say, well, it's more positive because of lack of social distancing, or we're not intervening enough, or the jobs that they're in put them at greater risk. Or is it that they have comorbidities that are higher in the population, so that makes them sicker, so they end up in the hospital more, which is overrepresented in this cohort, et cetera. So testing has been a tremendous challenge for us to at least to do anything beyond managing the acute patients and saying that a healthcare worker or EMS provider can go back to work. Just as an example, we are capable of doing testing in Boulder. We've been able to do that for over a week. So far, we've received 31 test kits. We can turn the test around in less than 2 hours. So you come in, but we've had to preserve those for where we need that 2 hours, because we've only gotten 31 kits. Of the other testing that's out there, over 90% of it's been done by private labs. So the state testing has accounted for less than 10%, at least from the healthcare point of view, and I think probably across the state. So we are pretty far behind on our ability to expand our testing, and it's going to be critical as we start to relax some of these stay-at-home orders. I don't know what to do about it. We've done everything we can our end. We're ready to do testing. For the lab stuff, we're missing, we don't have enough swabs or medium. And for the in-house testing, it requires a specific kit that we don't have. We have started doing the antibody testing, which is more measures people that are convalescing. So they've recovered and now they start to manifest the antibodies in their bloodstream. And again, we're unclear how that translates to immunity, but there's assumption that for some period of time, it does infer some immunity. So we received a grant and we're going to be testing about 200 individuals over the next week. And then hopefully we'll be able to expand that. And it is available to providers in the community to order as well. So that's some positive movement there. It doesn't help us as much on the front end of managing people when they're acutely ill. It's more of a post-illness test. The other thing I wanted to talk about is as part of the relaxing or changing of the stay-at-home order was also, there's been a lift on the prohibition of elective surgery. And so as of Monday, we will be expanding our inpatient and outpatient surgery. It's a little bit unclear the specifics around it. A call on the governor today suggested that they were going to come out with more guidelines, but essentially what they're saying is we recognize the need for this, that the harm being done by the delay is starting to exceed the risk for COVID. The primary reason to not do these surgeries was to create capacity and preserve PPE. And so any prohibition around it or restrictions will likely be related to your a hospital or health system's ongoing capacity and the ability to provide the extra protective personal equipment that would be necessary to expand the efforts to operate. It's not about spreading COVID or the safety. So if I had one message to leave here and to spread to the community, is that we are starting to see significant harm in our community and our patients because of people deferring care, being afraid to seek care. When I rounded in the hospital this weekend, there were a number of concerning cases of people that required emergent bypass surgery, coronary stents, some that had sat at home for 2 or 3 weeks, delayed strokes, et cetera. So please, my encouragement is to please go see your doctor. There's probably not a safer place in Boulder than the hospital. So it's one place where we test everybody with any symptom, and we have not had a positive employee for over 3 weeks. The 13 positive employees that tested positive, and that was at the beginning of the outbreak, we did contact tracing. And as far as we can tell, they were all infected in the community. So you're walking into a facility where everyone's wearing masks, gowns, washing their hands frequently, and their entire training and existence has been around preventing infection. And so people should feel very comfortable and very reassured that any hospital, not just ours, is a very safe place to be, and is much safer than sitting home with ongoing chest pain or mild symptoms of any kind, or anything that worries you. Now, if you don't want to go, obviously the emergency department isn't the primary place to go to, but contact your physician. If your doctor feels it's okay for you to get your surgery, trust the judgment of your surgeon. I will finish up with addressing some, I think, reasonable questions around adding elective surgery. One, do we have the capacity to do both? And I think you saw from the slides that were presented this evening that all the hospitals have capacity, particularly around med-surg, which are your straightforward beds that most people would recover in. Very few surgeries require an intensive care stay after the surgery, and those are generally predicted. So we absolutely have capacity. If we need to increase our ICU capacity, we've spent the last month planning, and we demonstrated that we can increase it 5 or 6-fold. And so a month ago, although it was a challenge, I feel much better about a plan to accommodate an increase. If there's a surge, can we manage the surge? And yes, we have a plan. I also think that we're going to have a lot more warning, and so we'll see a gradual increase in patients. Hopefully, the social distancing, if it relaxes too much, we begin to see a surge. We're now at a doubling time of 15 days, and when we started, it was 1 to 2 days. So that exponential growth on those graphs we were seeing at the beginning, it's much flatter now. It's not going to jump to 1 to 2 days. It will start to gradually increase. And just to remind people, our ability to decompress the hospital is very good, and we can. It's not unusual for us to discharge 30, 40 patients a day, so we can create capacity very quickly as well. So we feel good about our ability to accommodate these patients. We have significant concerns about any further delays. And we would like to emphasize that it's a very safe place to be, and it's absolutely the place to be if you have any medical needs right now. I'll pause there and take any questions.
Very good. Thank you, Dr. Vissers. That was very helpful and very thorough. Does anyone have any questions for Dr. Vissers? Very good. Well,
I do. I have one.
Okay, Rachel.
My question, and I'm sorry if I missed it, my audio was going in and out, so I'm trying to mute my screen to see if that helps, FYI. But my question, you said you were going to do 200 antibody tests, antigen, I forget what the word is.
Sure.
Antibody, I think. Who qualifies for that, and will that ramp up? I know a lot of people would like to get that testing, so how will that work? Thanks.
So right now, and as you may be aware, there's all kinds of antibody tests out there, and some are more sensitive and specific or better than others. And we think we've identified one that at least shows the best characteristics. The testing right now will be primarily done on our employees who are working directly with the COVID patients. So those theoretically are people at higher risk, or at least have been exposed before. If we know that they're convalescent or they're positive, then we can try and primarily place those patients working with those that are COVID positive. So there's a direct impact, but the primary goal of the first 200 is to see if the testing works, get a sense of the quality of the test, and be able to expand it. This was a grant that was internally funded through our foundation. However, we do have the test, and we'll make it increasingly available to providers. So if someone in the community wanted it and their provider thought there was a reason to get it, we can do the test at BCH, or at least we will be shortly.
Thank you. Thanks for all the information tonight.
You're welcome.
Great. Well, I don't see any other hands raised. And so thank you again. We really appreciate these weekly updates, and it's been pretty amazing how responsive BCH has been, and it seems like you're quite on top of things. So much appreciated.
I've got a great team and a great community. Thank you, Sam.
Very good. So I guess, Jane, at this point, we'd be on to COVID response.
Yeah, absolutely. So Carl Castillo did make his presentation about state and federal legislation. So the next person will be Kurt Fernhaber, our Housing and Human Services Director. So Kurt.
And so if I could just interrupt right before Kurt starts, I've had some requests to make sure that we have time to get out for the 8 o'clock howl. So Kurt, if I interrupt you in 15 minutes, or if you're not done or we're in the middle of it, we'll come back to it. So take it away.
I think we'll be done before then. Again, so Kurt Fernhaber, Director of Housing and Human Services. I'm going to talk about 3 different things this evening. It's going to be pretty concise. The first is the current rent picture in our community. What information have we found out? Process for those needing rent assistance, and finally, funding for food and rent support that we as the city have put out there. So we got some information a couple days ago from the National Multifamily Housing Council. and the Colorado Apartment Association, and that guides some of the information in front of you. So what we looked at recent information and then what it looked like about a year ago as best we could. So if you look at the national survey, there's been a 16% delinquency recently, compared to 10% from April a year ago. For Colorado, we're doing a little bit better than that, 9% and 7.4%. Although the 7.4 was from January, February a year ago. 3% of the renters in Colorado have approached their landlords and had conversations about deferment of rents. So in Boulder, BARA did a member survey. I think we got the results earlier today. And you'll see 88% at a normal rent collection. And as mentioned, there are several payments were late, but 88% of renters were able to pay their rents this month. And that applies, to market housing and those under the BARA membership. There were numerous requests for assistance in April, and I think one of the important messages here is if you are struggling with your rents, to reach out to your landlord. And we have found that many of the landlord members of BARA have really worked towards finding solutions for their renters. Boulder Housing Partners and our Boulder County Housing Authority. So Housing Partners did relatively well in April. They normally have about a 3% later unpayment amount. In April, it was 6%, which represented about $100,000. And they also have market units. So for market units, if someone lost their position or their job related to COVID, they would give up to $1,000 in waiving rent. And for the affordable units, if you lost their job, both the Housing Authority for the county as well as Boulder Housing Partners waived the April rents. So that really helps get a number of individuals and households over that initial sort of shock threshold of losing their position, being able to cover their rents, while things like the stimulus check and unemployment insurance come through. So the Housing Authority received 85% of their rents. Typically it's 97%, so very similar to BHP, and 4% had difficulties paying rents. Next slide, please. So one of the important developments over the last few days is that the Boulder County Housing Authority has opened up a helpline for anyone who's struggling with either rent or mortgage. And the Boulder County Housing Authority has a team of housing specialists who work with community members who are struggling to pay their rent and need advice on their mortgage as well. The housing specialists will work with each household to explore self-resolution options, including applying for unemployment benefits, negotiating with their landlord, tenant rights, education, and referral linkage to community mediation services. So we've also increased our mediation services. Both the City of Boulder and City of Longmont have mediation services. So we've sort of split those out. The City of Boulder mediation has expanded their service area to include Gun Barrel, Nederland, Louisville, and Superior. And then the City of Longmont has expanded to Lafayette, Lyons, and Allens Park. So these housing specialists We'll also work with them on an individual basis to understand what housing supports are best aligned with their income and their particular situation. So you'll see the phone number there, as well as the web address that people can go to for those supports. Next slide. So this represents the funds that Housing and Human Services has put out over the last 2 or 3 weeks. These are funds that have gone out earlier than expected to these organizations. All of these organizations would have already received assistance in 2020. These are early payments towards that. So EFA is the one organization that's primarily focused on rental assistance, and the others are focused on assistance for households needing support with food. So I will stop there for any questions that you may have.
Very good. Thank you, Kurt. That was super helpful. I see Mary's hand up. Mary?
Thank you, Kurt, for that. So just so everyone knows, I'm having dinner, so that's why I'm turning off my video. But I wanted to, first of all, thank both the City of Boulder and Longmont for expanding their coverage in their mediation services. I think that's outstanding. I had just one question about the data that you presented at the beginning on renters.
Want to go back 2 slides?
Yeah, please. Right there. And I was just wondering, so it was the Colorado survey. So that is as of January and February. Will that be rerun, or how will we know what happened in March and April?
So the 9% is a more recent look at the delinquency rate. I don't know the exact date of that. I compared it to January and February of the previous year. I don't know the schedule for the next survey of that, but we will find that out.
But they are planning on doing that again?
I will have to get back to you on that.
Okay. Thank you.
This survey was, or the 2 surveys that I mentioned are specific to concerns about the current environment, though.
Okay. That's all I have. Thank you.
Yeah.
Great. Anyone else? Rachel, you want to wave your flag?
I'm good. Also eating, sorry.
Okay. So very good. Kurt, thank you very much. That was helpful. It's good to track this. As Mary says, it's going to be interesting to see as we get the additional data going beyond February. So, okay, so I would guess, I'm looking at the time, it's 7:44 right now. So I think our next step, Jane, right, is COVID response.
Yeah.
Right. And so if we get launched into that, I think we probably would just interrupt somebody in the middle of their thoughts. So I'm going to propose that we take a break until 5 minutes after 8. Does anyone have any feedback on that?
Well, actually, Sam, that's a 20-minute break, and we've got a long evening ahead of us.
Okay, well, the request was to break at 7:50. So if we want to take 5 minutes of discussion, then we can start that.
So could I just make a comment? The howl's pretty prompt. It starts at about 8. Yeah. I think so. If we pause at 7:59, we'll be okay. Yeah. I'm not going very far to howl. I don't think anybody does. So
it's fine with me. I personally probably wouldn't take the pause, but I've been asked to do it. So we'll get started and see where we end up.
Great. Thank you. So can we go to the next slide, Chris? Thanks. So we're currently in a place in the City of Boulder where we're in response, but we're getting ready to move to the next step. So As you know, our guiding principles around response have been preserving the healthcare system, focusing on equity, and ensuring continuity of government. So next slide. But as Susan talked about, and as the governor has said, we are now in a time where we're moving from response to recovery. And we have a 4-phase plan that I'll talk about in the next slide about that. Some of the goals of it is we want to integrate the work that we're doing in the city of Boulder with the state and public health guidance that we're receiving, because we still care about preserving the healthcare system and making sure people are safe and healthy. And that's the top priority. We also want to model anything that we do after state and federal guidance on reopening. And we'll be looking at national publications and other communities and best practices before we make efforts as a city organization to undertake the reopening of our facilities. And as Susan mentioned, we will have to continue to adapt to the information as it becomes available. One thing I do want to remind you of with regard to city facilities is that we have an order in place that closes city facilities until further notice. And I have indicated to city staff that that will be until April 30th, but it is, I think, very likely that it will continue after that because we, as Susan pointed out, have not yet met some of the safety requirements that we need to open those facilities. So Chris, could you go to the next slide, please? So the restoration of city services has been created into a framework, and we have these 4 phases. The first is limited travel, which again is similar to what the governor is saying about retaining 60 to 65% of social distancing. But the real focus of this is staying at home and only traveling under the circumstances where you absolutely need to do so. Phase 2 will be open, but a very limited opening, and it will be beginning to open city services, but only in accordance with public health guidance, and we are not at that point yet. Then phase 3, which will be much farther in the future, probably well into the summer, we will be open except large gatherings and vulnerable populations. So we may at some point be able to open many city services as long as we're protecting the vulnerable populations and staying away from large gatherings. So just an example of this might be city council meetings. It may well be that we do not start up city council meetings again for quite some time because we want to preserve the social distancing as the most important thing. And then finally, phase 4 will be fully open, and this will return to whatever the new normal might be. We don't know what that is. And the thing that I personally believe is that this may not happen until we actually have a vaccine available across the board. So it could be quite some time. Next slide. We have created a matrix for City Council to take a look at and for the community. And obviously we have not filled this in completely because we just have started to understand exactly how to work this. But phase 1 is where we are right now. And, or we will be at the end of next week when we've indicated that we would begin considering opening city facilities. So you can see that we've talked about community programs, and community programs are canceled. Parks and public gathering areas. Currently our golf course is closed, but we may begin at the end of next week to be thinking about opening that golf course as one of the first city amenities that we open. We also will be looking at other park amenities that may open, but again, this will depend on public health guidance. On customer-facing service centers, these will remain closed. One of the reasons for this is that we cannot assure social distancing in those locations, and until we can do so, it would be inappropriate to open them. Community facilities, the libraries, the age well centers, and the rec centers will remain closed because, again, we need public health guidance before we can open them. City administrative offices, so essential services will remain open, but telecommuting will continue for most city employees that are currently telecommuting. We've been able to prove that we can do a great job of it and keep the city running with a substantial amount of telecommuting. And so that is the plan for for the foreseeable future. And then with regard to special events and travel, we've already indicated that there'll be no city travel or through May 31st or special events through June 15th. So of course, all of our current online and virtual services will continue. So you can see that the rest of this matrix is not really filled out because we don't know when phase 2, 3, or 4 will start to open some of these facilities. And we hope to have more information for you a week from now. Obviously, we just heard about the governor's order change late yesterday, and we have a staff team that's working on making guidance for our city operations and facilities about when they will open. So next slide. This is the response team moving from response to recovery. And now we have the establishment of a recovery team led by recovery manager Pam Davis out of the city manager's office. We have 4 coordination teams. One will be focused on operations, which will be the restoration of city services and facilities. And so a point that I'd like to make here is that before we can feel comfortable opening city services and facilities, we need to know that every employee coming into the space is asymptomatic and does not show signs of sickness. And we need to make sure that they're masked, that they've got the appropriate PPE. And so before we can accomplish that, we need to make some changes to our facilities and available PPE. We have a coordination team focused on equity, making sure that equity is considered in all the aspects that we have of recovery. And earlier I mentioned the fact that we're going to be doing some training around enforcement to make sure that we are doing so equitably. We will have a team focused on the community, supporting individuals and community outreach, on the economy, supporting businesses and partners in economic recovery, and finally on finance, the city financial management and grant management. A really important point that I know you all know is that we want to align with county and state recovery efforts. We need to be all in this together. And if we stray or have different rules, it makes it very hard for our community to know how to react, how to reopen, how to start their businesses again. And so we're trying to work super closely with the public health department. And I know they are working hard with the governor's office to make sure that we have consistency. And then finally, as I indicated earlier, next week, our COVID update will include some additional information on the restoration of city services. So I went through that fast so that you can go out and howl if you want to, but I'm ready to answer questions.
Rachel.
Hi, everybody. Thanks, Jane, for that. Just one question. Will the East Boulder Rec Center have a different timeline? Like, do we see the CRC continuing even after the rec centers are open?
So it's almost impossible to answer that, and so I'll do it this way. The CRC is going to remain open at the East Boulder Rec Center as long as we need it to remain open to protect individuals that are unhoused. And we're also expanding CRC a bit to include individuals that maybe are released from the hospital, but they can't actually go home to recuperate because of vulnerable populations at home. So we do have some extra beds there that we want to use for those folks. So until the time comes when we don't need to use that facility to help sick individuals, it's going to remain closed. And the other part of your question is, what about the other rec centers? And rec centers are going to be a difficult decision to open them because of the fact that there's so much equipment there. There's so much interaction among people. Social distancing is much harder in a rec center than it is in other places. And so we're going to have to be very careful and cautious about how we open up. So I have no clue about when those actually will be opened.
Fair enough. And can you elaborate? So I don't know that I had heard about the CRC expanding. It sounds like maybe it's expanding beyond unhoused individuals, just for maybe anybody in the community who would need a separate place to recover to keep their family safe. Did I hear that right?
Well, first of all, it's just about to start, I think, tomorrow. So I probably gave you advance information that perhaps Kurt is shaking his head over, and I'm sorry, Kurt, if I did that. But what we have seen is that we have some capacity at that facility for people, and we're able to separate those that are in the unhoused population from other individuals. And it would only be for persons, as I understand it, that are released from the hospital to go home, but they can't go home because if they were to go home, social distancing could not occur. And there are perhaps vulnerable populations at their home that they could infect. And so this is a respite kind of area for a very limited number of people that meet those specific qualifications. It's not anybody. It's people that can't otherwise go home.
Okay, thanks for clarifying. That sounds like a good additional service as well.
Yeah.
Thanks to you and Kurt.
Great. Next, I've got Mark and then Mary.
Thanks, Jane. Earlier in the presentations, it was discussed that as Governor Polis loosens restrictions, he might paradoxically be requiring some greater enforcement of those looser restrictions. Will we be adopting that principle as we move forward?
So we don't know what our Boulder County Public Health Department is going to do. We're really going to take our lead from them. The way that our order reads right now is that we have adopted, if you will, the Boulder County stay-at-home order, and my presumption is that they'll move to a safer at home order that we will adopt by reference. And so we'll be following those rules, whatever they might be. Did I answer your question?
Sort of.
Like what didn't I answer? I'm sorry.
No, the issue was that the governor apparently made some reference to moving past an educational orientation in enforcement to something a little more robust, even as he is loosening restrictions. And my question is that an approach that we would be looking to adopt as well, or are we going to, or not?
Yeah, okay, so I lost my train of thought, which is why I didn't answer your question, I guess. So the way that things have been working right now is that if people see something that they'd like to report as a violation of the stay-at-home order, they call it into the public health department. And if it occurs in the city of Boulder, the public health department will then send us information about that. And we have some of our non-sworn personnel that go to check it out and then report back to public health and provide information to the possibly offending party. I don't know what public health will want to adopt with regard to the governor's call for increased enforcement. And so we will do whatever public health is indicating is the appropriate thing to do with regard to that. Again, with an equity focus.
Thank you.
Yes.
Okay, so Mary, it's 6:58. You want to ask your question or do it after the how?
I can wait after the how.
Okay, very good. We'll break and meet back here. Is 8:05 okay, Aaron, or what would you like? I hear the house starting right now. 8:05, we'll return. Okay, it is 8:05. Back in session. Mary, if you have a question.
Yes, I do. Thank you for that, Jane. My first question is regarding the restoration of operations. You mentioned that there are certain, you mentioned PPEs, you mentioned masks, and I was just wondering how testing plays into that, given that we heard earlier that we're not quite there with testing.
Right, so testing really, as the public health folks talk about it, applies to persons that are exhibiting symptoms and then they get tested to see if they actually have the virus. And I hope I didn't use the word testing, but maybe I did. What I am talking about is that we would like to make sure that all of our employees coming into work are safe, and already a number of them have their temperature taken, and that's the main test that we do to make sure that they don't have a fever. So we need to put that in place widely.
No, and you didn't mention testing. I just deduced. And then my other question has to do with as things begin to reopen, will some of the furloughed employees be brought back?
If the services that they would have been providing are added back in. So an example of furloughed employees would be lifeguards that we had hired for the summer. So I don't know if the pools will open or if they won't open, but if they were to open, we need lifeguards. So those folks would be brought back.
Okay. Thank you. I do miss swimming. And then my final one is just to give my thanks to staff who's been working hard with the emergency response connectors and all of the work that they're doing. So I'm very grateful for that. And I just wanted to thank everyone that's been involved in that. So thank you.
Very good. And Bob, you had your hand up.
Mary asked my question, thanks.
Okay, very good. So remind me, I've forgotten what 1D that we added was because I don't have a sheet in front of me.
So that is a motion to approve council rules related to virtual meetings.
Great. And Tom?
Thanks, Sam. I have a presentation that should come up, and Sarah and I are going to do this together. There we go. So we have been operating ad hoc since we went to virtual meetings. And last Thursday night, I think it was, there was a council chat, and there was a kind of orchestrated effort, or maybe disorganized effort, but to disrupt the meeting by people who did things that were completely inappropriate. The challenge that we face as a government is that we can't ever do anything that would seem to be a viewpoint-based restriction. So we have to have clear rules that we establish beforehand that allows us to prevent people from shouting racist things and putting up pornographic videos and doing things that have happened in other communities, while at the same time making sure that we promote and allow for free speech. So we've developed some proposed rules, and there are 3 sets I'll go over relatively quickly. I posted them all on Hotline Friday and today, or Monday and today. And I'm happy to answer any questions. The slides take a second to advance, and I apologize for that. I was hoping that my talking would have allowed me to do that. Chris, can you advance the slide? I apologize. So there are 3 sets of rules, and when I get the slides up, it'll show you. There's 1 set of rules which is a modification of the council rules of procedure, which are found in Title II of the Boulder Revised Code. And what I've done in the proposed rules is take out things that involve live participation. I've changed the open comment rule to change it from 15 to 20. As you know, prior under the current or the old rules, we had 15 people chosen at random who signed up the day before and 5 who could walk in on the day of the meeting. So since we can't have anybody walk in on the day of the meeting, we just extended it to 20. I guess the presentation is gone now, but I'm hoping we'll get that back. There are things about not having signs in the chambers and things like that. There also, under the First Amendment, you have a council meeting is what's called a limited public forum. So in a limited public forum, you can control content, but not viewpoint. And what I mean by that is that you can obviously say on our agenda, we're only going to have people talk about the public hearing matters. It's changing there. So we can do that, but we have to make it clear that what we're doing is focusing on the business of the city, and that the participation is going to be for the business of the city. So there's those rules. The second set of rules are the quasi-judicial rules. As you know, council from time to time will hold quasi-judicial hearings. In fact, at the next regular council meeting, you will hold one on a landmarking. Quasi-judicial proceedings are governed by due process rules under the 14th Amendment of the United States Constitution. So that's because in any quasi-judicial proceeding, you are deciding someone's property or other rights. So they're entitled to due process. So the lawyers in my office made an effort to come up with virtual rules. I'm asking council adopt these rules for council proceedings. And each board or commission that has quasi-judicial hearings, the Planning Board, the Landmark Board, the Beverage Licensing Authority, they will adopt them as well. And they do with how do you present evidence if you're on the phone, how do you question a witness, how do you swear a witness, and they're pretty thorough. I appreciate David Gear led that effort with the lawyers in the office, and they did a great job of coming up with some rules. The last set of rules are general rules for virtual meetings. And Chris, if we could just go to the last slide, I'd appreciate that, because I have those rules printed out and I wanted to just go over those in a little bit more detail, because they sort of summarize everything that we're trying to do, and they address some of the issues that have happened at the council chat and give us ways to deal with them.
Tom, I apologize. For some reason, the computer is frozen, so I'm going to unshare this and reshare it and hope it gets your slide up.
Okay, thanks, Chris. But let me just explain what we're trying to accomplish. In Zoom meetings, you may have noticed that we did not authorize the public today to be shown on video. And that's because there are techniques that people can use to hack into the video and either show videos that are obscene or inappropriate, or display things behind them as we did with, as you can see, with virtual backgrounds. So we're concerned about that. There are people who signed up with names that suggested that they did not have an interest. So, for example, someone signed up as the name of a porn site, and staff had to decide whether or not to allow that person into the meeting. I'm very concerned about any staff member making a decision about who should or shouldn't participate. So we have these rules that Chris has gotten up. So the first one is important. Meetings are conducted for the business of the city of Boulder. Activities that disrupt, delay, or otherwise interfere with the meeting are prohibited. That's a clear statement that we're limiting that this is a business meeting, and that creates the limited public forum that I talked about. There's the next one is an express limit on speaking. The third one is that people have to use their real name. This prevents the staff from having to make a judgment. Obviously, the name of a porn site isn't a real name, and then you have a criteria that a staff member can use not to allow someone into a meeting. The next one prohibits video, as I spoke, and the last one gives the presiding officer or the person presiding at the meeting the ability to control the meeting. So that's sort of overarching. Those are incorporated in the changes in the council rules, but they're intended for all public meetings to allow for us to protect the community from some of the things that are going on. The challenge that we face is when we have an in-person meeting, there's a natural limitation by the number of people who can get to the meeting. When you have a virtual meeting, everybody in the world has the ability to get in. And there are people in the world who have poor judgment and do bad things. And so what we need to do is adopt, my recommendation is that we adopt these rules to allow for some protection and still be able for the city to do its business.
Great. Thank you, Tom. That's great. It's really good that you took this on and were proactive with this. I have a question from Aaron.
Yeah, thanks very much for this, Tom. I had a couple specific questions. So one of them was the rule is that people have to register for open comment. I think that's in these rules by 2 p.m. the day before. Just checking in, and this is probably more a question for Lynette. Do we need that much notice, or is it possible to have the cutoff sometime closer to the meeting?
We could probably have it closer to the meeting. What we do is we randomize the list and then post it and then contact all the people separately. So we would just need time to do that.
And Aaron, I think that's been the rule since 2017, if I'm not mistaken. We're not really changing that. We're eliminating the 5 who would come in person and adding those to the randomized to allow for more participation.
Sure. Yeah, and but that is the change that since we don't have the in-person. So anyway, Lynette, maybe that's something you could think about if maybe there's an amount of time that would make that still doable.
Aaron, if I could just interject for a moment, we also will be requiring people to register to speak during public hearings. So we don't have a public hearing tonight. So tonight, everybody who's on the line as attendees waiting for their turn to speak is someone who's been approved to speak for open comment. But we will need to determine how our registration will work. We can create a form within the actual Zoom platform for people to register with their name in advance. And we will have to make some determination about how late we let people register.
Right, and that one wouldn't be randomized, right? So it seems like allowing that until a fair amount closer to the meeting would be easier.
I think we could allow it right up until the meeting, but you're correct. It's not randomized and there's not a limited number of people, so it's not quite as big of an issue.
Okay.
Can I colloquy on that, Aaron, before you ask your next question?
Please do.
So that is a big change though, right? Because usually you can register for public hearing comment up through, while the hearing is going on, if I'm remembering correctly. So why are we cutting it off at all?
So we actually could allow the registration to occur through the meeting, but they don't get the link to come into the meeting in the Zoom platform until they've registered. If we require registration. Certainly people can watch it on the live stream, and then when we get closer to the time for public hearing, if they decide they want to speak, they can register and Zoom will give them the link to access the meeting.
Because it does seem like that sometimes happens. Somebody's listening and then they, go up to the registration table and decide they want to speak while they're hearing something. So, sure. I don't know, Tom, that your rules hit on public comment at all. Or any changes there?
We changed the
public hearing comment.
The public hearing, we did not change, no.
Well, except that you're requiring them to register to speak at the meeting using that person's real name.
That's
so you are requiring a registration.
In the overarching rules for all virtual meetings, if you approve those, that would be required, yes. But we did not change the council rules on public hearings at all.
Thanks for letting me colloquy, Aaron.
Yeah, of course. Okay, the next question was, for the virtual meetings, it says the person presiding at the meeting shall enforce the rules by muting anyone who violates any rule. Is the mayor count as the person who's presiding?
Well, these are yes, at this meeting, it's the mayor. These would also control council chats. So would be one of the council members, I would think, would be the presiding person at that meeting.
So just would they allow for a staff member who's running the meeting from a technical perspective to mute people?
My preference is not to do that. Usually the case law involves a presiding officer, usually an elected official, making that decision. For council meetings, council members have legislative immunity, staff members do not.
Gotcha.
And also, Aaron, and Sam and I have talked about this. Our preference is, like all mayors in the history that I've worked with, Sam tries very hard to not cut people off and to give them an opportunity to conform their behavior or to to not do whatever they're doing, which would be violation of rules.
Yeah, absolutely. And I in no way want to say that we should be cutting people off quickly or easily. But just with this fully virtual meeting, you could certainly imagine bad actors from around the country or the world, doing things that are kind of vile and horrible, right? That you would really rather cut off sooner rather than later, as opposed to like a community member who we just feel like we should have a conversation with, right?
And if a presiding officer has difficulty managing the technology, they can verbally direct staff, the technical host.
Okay, so maybe that's
direct it verbally before we can do that.
Gotcha. Okay, so maybe that's the out there, is if because I know Sam's doing a million things, right? So trying to find that one little spot to mute somebody could be a little tough. Yes. And then just my.
Oh, I'm sorry. If I may colloquy on
please.
that one, just real quickly. So this afternoon we had a pre-meeting for the KGNU Council chat, and in that case, Tom just said that a council member would need to terminate the whatever conversation is undesired. So how I couldn't see that happening in that setting.
So Mary, I guess maybe it's better to say a council member should make the decision and then direct somebody else to do it. Obviously, in the KGNU studio, you wouldn't have the ability to do that. But it's best if the decision maker is an elected official, and then the direction goes to some other staff person who can actually do the physical muting.
Tom, in that case, KGNU is the host of this program. They have their own standards and guidelines. Yeah. We're simply serving as guests on an existing program that they have. So they have proposed that their host will make the decision based on their own standards and guidelines as a radio station.
Yeah, they have FCC rules they have to deal with.
Correct.
And just to colloquy on that, my experience in our council chat last week was that when the images came on that were extraordinarily offensive, like you wouldn't want to build in any delay, like where I would look at it and see it, or maybe I'm not even looking at the right block to know that it needs to be muted. So I wouldn't want to make it so cumbersome, although I appreciate the liability and risks assessment. When something, pornographic pops up, say like you want that gone immediately. So I'm a little bit worried about like building in a delay and requiring like a direction to.
Yeah, it's best if we can prevent it from happening. It's best if we can do it quickly. Of course, Rachel, the challenge is that we're a government and the First Amendment precludes us from restricting speech. So we have to be careful about not being too aggressive about stopping people from speaking, because sometimes a speech that's offensive is viewpoint based, and we have to respect that.
We do believe that by moving into this webinar platform, which is the platform we will use for all council meetings and virtual council chats that use Zoom moving forward, will help prevent some of that from happening, so we're not put in that position.
Great.
I was just going to say, like, what I'm talking about that I think Sarah saw last week as well was not something that I think is confusing with protected or confusable with protected free speech. It was clearly across the line.
Yes, absolutely. No question.
And by not allowing video from attendees, that prevents that kind of horrible visual immediate thing that you might be broadcasting out, right? So the audio things, while they could still be really violent, offensive, might be a little bit more tolerable for 5 or 10 seconds.
Absolutely.
So then my last thing was, I thought when I read through them, they looked good. My one request would be if we could get a follow-up with more of a redlined or kind of a change sort of approach from what we had before, just so that we could do a last check afterwards, just to see if we felt like there was some change that wasn't.
So I thought the ones I posted online were redlined.
Not to me when I opened them.
I apologize for that. I will take a look and send and post another copy.
Maybe I was looking at them in preview mode that didn't show the red lines, but
that's entirely possible. But I thought I had posted it. In fact, I think I double checked to make sure it was the red line copy.
Okay, I'll take another look as well.
Okay, thanks, Aaron.
That's all I had. Thank you.
So Mary, I've still got your hand up. That was from the colloquy, is that correct? Or do you have more?
That was from the colloquy, so I'm good. Thanks.
Okay. Very good. So Tom, what's your hope? Do you want us to take action tonight, or would you like us to take action at a future meeting?
My preference would be if you would take action tonight, because then we can govern this meeting and the meeting on next week by these rules. So if you'd approve them, we can certainly enhance them, or you can approve them next week if you prefer.
So Aaron, might I make a suggestion that we go ahead and approve them tonight, and if you find anything that you would like to see changed, we can make an alteration?
Yeah, that was my thought. I'm happy to make a motion.
Okay, go for it.
Sure. I'll move that well, I don't actually have the names of them in front of me, but that we approve the three things.
Aaron, hang on one second. Sorry to interrupt. Oh, Bob had his hand up, but he put it down. So was that to make the motion? Anyway, go ahead, Aaron.
If you can bring slide 2 up, please.
I'm trying. Chris, can you do that?
I hate just saying so moved. I like to put just a little bit of specificity in a motion. So I'll move that we adopt these amended council rules of procedures, rules for quasi-judicial hearings, and general rules for virtual meetings.
Second.
Oh. Okay. So if anyone objects, speak up now. Okay, we'll record that as a unanimous vote in favor.
Thank you.
Thank you. The clarity is very helpful for those of us who are hosting meetings. Appreciate it.
Okay.
Okay, your open comment is next.
Very good.
Okay, so Sam, I have a list of 13 people who are invited to participate in open comment. I think most of them, if not all of them, are on the line. So I will go ahead and just call them by name and unmute them if you're okay with that.
I can call them if you want to unmute them.
Sure, that's fine.
So I have the list in front of me as well. So we start with Amanda Mercado, followed by Chelsea Castellano, and then Jackie Richardson.
Okay, I'm not seeing Amanda on the line. We have a little bit of a challenge because one person has called in with a phone number. So I'm not sure who that person's name is, but it does look like Chelsea is on the line. Mayor, did you want to assign a time limit for this?
It's 2 minutes apiece.
Okay, so Chris, I think you were going to pull up the timer clock. If you want to reset, that would be great. And then when I unmute, okay. Chelsea, you're live.
All right, can you hear me?
Yes.
Yes.
Okay, perfect, thank you. Chelsea Castellano, 3481 Cripple Creek Square, Boulder. I'm here as an organizer of the Bedrooms Are for People ballot initiative, and I'm here to speak with you about the online petitioning ordinance that is in front of you for your review. While we are so appreciative of the intent of the ordinance, there are a few critical issues that need to be resolved in order for this ordinance to be fair, balanced, and effective. In addition to the comments that we've already provided to you via email, I'd like to highlight one of the key issues. Section E of the ordinance requires a 90% response rate in order for the entire petition to be deemed valid. So as it stands now, if the clerk contacted 100 people, only 10 people not responding would permanently invalidate the entire petition and effort. First, requiring a 90% response rate is unrealistic at best. From an email marketing perspective, a sender would be lucky to get a 20% open rate. Plus, with the growing number of robocalls and scam calls from the quote unquote IRS and other so-called government entities, it is unreasonable request to have 90% of the people respond to an unexpected email or phone call by the city clerk's office. We believe requiring a response rate to a city request is an undue burden for the people who are hoping to participate in a fair democratic process and would like to recommend removing that element altogether. That being said, we understand the desired intent to ensure that a high portion of the signatures are valid. We want that too, but if you are going to require some type of a response from petition signers, it should be requiring a response from people who feel that their signature is not valid. People who do not respond should not be assumed to be guilty of fraudulent behavior. I'll leave you with this. it shouldn't be harder to indicate that you want the chance to vote for something than it is to actually vote for that thing. All of these measures and requirements are just to give the community an opportunity to vote and make this ordinance.
Thank you, Chelsea.
Thank you.
Next, we have Jackie Richardson, Kristen Nordback, followed by Lynn Siegel.
Jackie, you're unmuted. Oh.
Hello, can you hear me?
We can.
We can.
Okay, so I think the phone number that called in is actually Amanda. If
Okay.
you wouldn't mind having her go before me, that would be great.
Oh.
All right.
Sure. I'm no longer seeing a phone number on the line. She may have disconnected.
No, I see it. It's right here, 218. So I can allow her to talk and we can see.
Yes, please.
Okay, caller on the line, you're on.
Hi, this is Amanda Mercado.
Okay, very good.
Hi, this is Amanda Mercado, and I live in the city of Boulder. Tonight, I'll be giving some background information about the no eviction without representation, the newer electoral committee. We are a group of renters and neighbors. Among our committee, you'll find school teachers, waiters, librarians, researchers, people who all live and work in Boulder. And are concerned about the rising rates of homelessness and the nationwide eviction epidemic. And we've been working on the issues of eviction and housing security in different ways for many years. Our work has ranged from tenant advocacy and education to emergency eviction support. And most recently, we conducted a research study to improve our understanding of eviction rates here in Boulder County. We spent hundreds of hours attending eviction court and published a report, which Jackie Richardson will share more about in just a moment. All of this led us to learn about the growing nationwide Right to Counsel movement, which is a coalition of municipalities, elected leaders, and advocates who are working to give folks the right to an attorney in eviction court. Over a year ago, we began meeting with people around the country who have successfully implemented Right to Counsel programs in their communities. We have worked with local attorneys and legal aid groups to learn more about the eviction process, Colorado housing law, and the needs of our legal community. We engaged an attorney and planned and argued the details of our ballot language to make it as strong as possible. In January, we began collecting signatures, and by mid-March, we estimated we had almost 2,000. We are on track to easily meet the threshold to get this measure on the ballot, and then came COVID-19. As the first reports came out in Colorado, we made the difficult choice to stop collecting signatures even before the stay-at-home order had been issued. We want to get this initiative on the ballot, but not at the expense of public health. At the time, we anticipated that we would have to stop petitioning for at most a month, but it became clear that that would not be possible. We're grateful for the council that you're taking this into account. And thank you.
Okay, and then we're on to Jackie Richardson, followed by Kristen Nordback, and then Lynn Siegel.
Okay, hello. My name is Jackie Richardson, and I've lived in Boulder for the past 16 years, and I'm going to summarize our findings on evictions in Boulder County. As Amanda mentioned, we've collected our evictions data, which is available in our report at www.newrboulder.com. So our biggest findings can be summed up in 2 points. First, 88% of evicting landlords have legal representation, while only 2% of tenants do. And second, without legal counsel, more than 75% of these tenants will ultimately lose their homes, either by direct eviction or with stipulations that do little more to buy them some extra time. So we believe the no eviction without representation ballot measure, which is inspired by similar working programs all over the country, could dramatically correct the power imbalance in the judicial system, address a root cause of the homelessness crisis in Boulder County, and protect the livelihoods of the working people of Boulder. And it could also provide significant savings to the city of Boulder, as disruptive evictions create a lasting burden on public resources. For example, the Philadelphia Bar Association found that by investing about $3.5 million into Universal Evictions Council, Philadelphia could save up to $45 million annually. Also, the Mid-Minnesota Legal Aid found that tenants with full representation were 4 times less likely to use homeless shelters in the 60 days after their court hearings. The newer ballot initiative would not only cost the city of Boulder nothing out of pocket, since the funds would be coming from an increase in fees paid by landlords. It's also crucial to allow this measure a fair shot at getting onto the ballot, given the massive spike in unemployment and the oncoming tsunami of evictions that are likely to result from COVID. The city needs to have mitigation plans in place, and this would be a crucial part of that. And my friend Megan is going to share more about the details of the initiative shortly.
Thank you, Jackie. Next, we have Krista Nordback, followed by Lynn Siegel and Mark Gelband.
Hello, this is Krista Nordback, 777 Delwood Avenue, Boulder. I am speaking today on behalf of Bedrooms Are for People ballot initiative, and I'd like to reiterate Chelsea's point that it will be near impossible for us to get 90% of people to respond to an email or phone call. 5 to 15% maybe, but 90%, I don't see that ever happening. We would be more likely to win the lottery. So another point about the proposed language, I'd like to mention the concern about privacy for the 4,000 plus people who would be signing our petition. The proposed ordinance would post their names and addresses on the city's website. We are very concerned about the privacy and safety of those who choose to support this initiative and any of the initiatives for that matter. We have already received hateful messages, and we wouldn't want 4,000 other community members to be exposed in the way that we are as organizers. We feel that revealing that level of personal information publicly and then having that information connected to their support for this ballot measure is a high price to pay for participating in the democratic process. We understand the intent of this section is for people to see if they themselves are on the list. So we are suggesting that instead of putting out everyone's name and address, put out information that is identifiable by the individual, but not everybody else. For example, the city could post a list of all the signers' initials and last 4 digits of their phone number. This could limit harassment of signers while still allowing them to validate that it was their signature. We hope you received our letter detailing this and other recommendations. And last thought, changing hats, I want to voice my support for 20 is plenty to reduce residential traffic speeds to 20 miles per hour. Thank you.
Thank you, Krista. So next we have Lynn Siegel, followed by Mark Gelband and Megan Arango. Would you like me to unmute, Lynn?
So, I unmuted myself. Can you hear me?
Yes.
Okay, yeah. First of all, you've received my emails from yesterday and today, and I really think that under these COVID circumstances, we've got to be a whole lot more accommodating to the public in an open process. I think that generally the council is just kind of assuming that this thing is going to be over soon and no problem. And I'm perceiving that this is the way of our lives, maybe for a decade. And why not assume that and take the risk of having the video up and a more interactive process and mix it up and not so draconian regulations with regarding to public process. And the chats are fine. If you don't want to look at the chat, don't look at the chat, but sometimes it might be illuminating to you, you know, but it's like anything else in life. Security actually comes back and hurts you ultimately. And in this COVID situation, it does that a lot in a much more intense way. The other thing I wanted to bring up is the antibody antigen plasma test. convalescent plasma and its use for a kind of a form of immunity or for people who are really sick. The whole idea of the blood test is where I think we should really put some of this money that's coming into from the state to be able to really do something about the 40 to 50% of people that are carriers and not knowing that they're spreading it and not knowing, you know, is that only in an active infection state? When it doesn't matter when you were infected,
thank you, Lynn.
How long you were infected, and I'd like our money to go there.
Thank you, Lynn. So next we have Mark Gelband, Megan Arango, and Patrick Murphy. Mr. Gelband here. I do not see Mark Gelband on the list of attendees. I'm not seeing him.
I'm having, Sam, I got a notice that he has an older version of Zoom, so I'm having to bring him in as a panelist just briefly for him to speak. So it will take a moment.
Oh, you're doing that? Shall we move on to one of the others?
No, he should be available now.
Okay, very good.
So at a time, can you hear me?
Yes.
Yeah.
Okay, at a time when the GOP seems hell-bent in keeping mail voting from being a national right, it seems odd that the city of Boulder would even consider not putting all 3 ballot measures to the people for a vote. At the very least, considering a reasonable form of electronic signature gathering. Number one. Number two, I want to switch gears. And like Kristen, I'd like to say that I wholeheartedly support 20 is plenty. And if we're going to talk about Vision Zero, but I'd also like to say it seems ridiculous that we would spend $100,000 to study something that's been proven in other communities. And speaking about things that have been proven in other communities, maybe Boulder should just stop pretending that we care about people on the street and bike riding and protected bike lanes. And I know y'all put this to bed or put this to rest last week, but the notion that we're still not considering closing down streets for excess street capacity gives me grave concerns. I heard a lot of hooey from Bill Cowern and the rest of the staff there. And then just yesterday on my run home, I saw that part of College was closed down with a couple barricades that clearly the city already has. It wasn't as if there was a staff person there. There was no one that was disobeying the rules. I went out there today and observed for about 15, 20 minutes, and it wasn't as if anybody was going to get hurt from those barricades. So I'd like to implore council to reconsider the notion of closing excess street capacity and walking our talk for a change and trying to help us move toward a less car-centric future. Thank you.
Thank you, Mark. And we have Megan Arango, Patrick Murphy, and Roy Arango.
Megan, you should be able to unmute yourself now.
Hey, can you hear me?
Yes, we can.
Yes.
Okay, Megan Arango. I'm also with Newer, No Eviction Without Representation. The Newer initiative will provide a tremendous service to our most vulnerable neighbors. Eviction, which has been linked to chronic housing insecurity, job loss, health declines, and homelessness, ruins lives. But studies around the nation have proven that with access to a lawyer in housing court, many tenants can reach better and safer outcomes when faced with eviction. The Newer initiative will provide free legal counsel to all renters who experience eviction in the city, and the service will be available to everyone, regardless of age, income, or immigration status. In his recent opinion for the Daily Camera, Steve Pomerantz asked, what problem is this solving? And the answer is clear. Tenants in Boulder need free legal counsel because they can't get it on their own. As Jackie mentioned before, only 2% of tenants appear in court with an attorney compared to 88% of landlords. Not only that, many renters don't show to court at all, leading the judge to automatically rule against them. So we have to ask, are we okay with this critical imbalance? Are we content with rubber stamp rulings that force families into homelessness? The benefits of Newer will come at no additional cost to the city. Indeed, many cities with right to counsel programs report significant savings because so many families are diverted from other safety net programs like emergency sheltering. Instead, a small fee, just $75 per year, will be placed on each rental unit. For reference, that comes to $6.25 per month. For those who say this will increase rents, we argue that rents often increase with renters receiving nothing in return. And while some have suggested this fee could face legal challenge, such a lawsuit would have to overcome significant legal precedent, which clearly defines the difference between a fee and a tax. We believe Newer is an obvious good and something Boulderites will support. Volunteers have gathered close to 2,000 signatures, and the initiative has been endorsed by many organizations, individuals, and elected officials. We encourage you to visit our website for more information. Thank you for all you're doing to help us.
Thank you, Megan. Next, we have Patrick Murphy, Roy Arongo, and Sammy Lawrence.
Good evening. My name is Patrick Murphy. I live in Boulder. Everything all together is different from anything by itself. The pandemic really is part of everything all together. And now everything all together is making us think critically of everything else. The Muni by itself has been an 8-year-old overripe albatross, hanging us by the neck. You need to let us vote to end it with one option or two. Your option, asking for more money, and or our option to use the existing money to reduce climate change now, not 5 years from now. Too much time, too much money, too little truth, and still no estimate of stranded cost or going concern. If you take money from the general fund again, it reveals a gambler's addiction and a pattern of theft. If you want to end the Muni, I can tell you how. Go to endthemuni.org. End the Muni, one word. Sign the petition and let us decide. And so we come to the online petition. Have we figured out the rules? I wish by now it was resolved because we have 45 days. The city had 532 days to figure this out, and now we have 45. Will this be Article 25 of the 2020 Muni Naughty List? The Muni needs a democratic rethink, and a Plan B needs to exist. End the Muni. Let real carbon reduction begin now, not 5 years from now. Thanks.
Patrick. Next, we have Rui Arongo, Sammy Lawrence, and then Sarah Dawn Haynes.
Rui, you may speak.
All right, can everyone hear me?
Yes.
Great, thank you. My name is Rui Arongo. I live here in Boulder. I'm also the campaign chair for the No Eviction Without Representation, or Newer initiative. And I'm here to talk with you tonight about the eviction crisis in our city. I expect many of you have read the guest opinion written by Steve Pomerantz, former city councilor, in the Daily Camera last week. In it, he argued that Boulder tenants do not need the free legal counsel provided by Newer because Boulder does not have a problem with eviction. Well, Boulder does have a problem with eviction now, and I believe Boulder's going to have an even bigger problem with eviction in the near future, given our COVID pandemic. I'll share some figures with you. From 2016 to 2019, the number of summons to eviction court in Boulder County increased by 27%. That's an increase by nearly a third, and that was before the COVID crisis hit. I am almost certain that in 2020, that number is not going to go back down. It's going to get even worse. The Colorado Sun recently shared a study that projected that up to 450,000 Coloradans could face eviction at the tail end of this crisis. In addition, Eviction Lab, coming out of Princeton University, the foremost authority on eviction in our nation, gave Colorado a 0 out of 5 rating for COVID-19 housing policy. I think we are in a grave situation, and I'm worried that there is a lot of human misery in store for us here in Boulder, our friends and neighbors, at the tail end of this crisis. I believe Newer is a component of alleviating much of that. It will provide a reduction, substantial reduction in evictions in the city at no cost to the city, that is. And I'd like to encourage council to consider that. Thank you.
Thank you, Ree. We got Sammy Lawrence, Sarah Dawn Haynes, and then Stephen Hagel.
Greetings. Greetings, dearest majority of City Council and co-conspirators. This will be my final public address to you in regards to accountability for the abysmal treatment, disabling, and cover-up of said actions towards me at the hands of Officer Lola Tai, multiple impeded investigations, a hospital, some City Council members, as well as those who sit beside them like Tom Carr, members inside the local courthouse, and racist people's actions towards me. The collective ignorance of all mentioned above is complacent racist behavior that is similar to Amazon's scapegoating a Black man in April of this year. Likewise, it is as well behavior that elders of the past warned us of. Specifically, MLK Jr. in Birmingham jail alluded to white moderators and how we cannot be angry at Black men when they try the path that I have arduously undertaken for healing and growth. It is for this reason I declare a holy, righteous, and civilized war upon all who oppose my path. Harassment and violence taken in my name will not be tolerated by me. The end of my path will consist of 4 things, 2 of which are a platform to address the wrongs done on the record, as well as the willful resignation of any major contributors to my pain and or public apologies after current events. The ancestors of this land, as well as my personal ancestors, guide me and stand beside me. The Creator, as well as spirits of others who have failed, fallen, and succeeded in paths like mine, also stand beside me. The community in this city and nation will stand beside me. Those who have experienced COVID-19's impacts will also stand beside me, for all of you have lived a fragment of the past 2 years of my life. It is with a heavy heart that I declare this war. However, I sacrifice my heart and become heartless towards all addressed. My heart is not needed when it comes to truly unleashing my purifying blue flames, especially when it comes to those ignoring my heart's pleas. There will be no questions taken publicly on this forum from me anymore until our demands are met. My medical records, full demands, and evidences will start being released tomorrow at 12 p.m. for public consumption. My name is Sammy Lawrence, and I'm the Dragon of the West. I will see you on the battlefield. Hashtag SOS.
Thank you, Sammy. So next we have Sarah Dawn Haynes, followed by Stephen Hydell and William McGrew.
Thank you. Hello. I am glad to be with you tonight. I am also here for the mechanics of the ordinance for our ballot initiative for bedrooms for people. We are concerned about the petition being disqualified if not having enough opportunities for resubmitting if we have issues found, and being able to cure any discrepancies. This is trying to avoid any fraudulence, but we believe that the petition committee should have the opportunity. If we go for 4,000 signatures and are disqualified because a portion are invalid, our recommendation would be to use the rules and language that already exists for in-person signature collection, and that we would have 15 days of filing to remedy. We are also looking forward to supporting the other ballot initiatives and hope that we can find an easier way to do this, since there's a lot on the line for the community. I also support 20 is plenty for our streets, and think that, not just housing, but also overall safety is so important for us. Thank you.
Thank you, Sarah Dawn. So Stephen Hydell and then William McGrew.
There you go.
This is Stephen Heidel, Grove Street, Boulder. I am talking tonight about 20 is Plenty and the adoption of option 2. Last year, City Council, TAB, and even Planning Board called for 20 is Plenty across Boulder. It's time to enact it. No more studies. Just let's do it. Option 2 will make the road safer for all users of all ages, races, and income levels. As we've seen with the current limited traffic, people are feeling safe to actually use residential streets. In Grove Street, I see walkers of all ages, skateboarders, rollerbladers, bicyclists using the road where before they'd be afraid to use the roads with all the traffic. Staff, a few reasons they don't do option 2 is they're afraid of negative feedback. Whatever we do, we're gonna get negative feedback. We saw this weekend with the COVID idiots out in Denver protesting. When we did the assault weapon ban, we had the NRA gun nuts out protesting. We will get that. We will get some of the car lobby. We'll get letters and emails, but let's stand up to them and enact 20 is Plenty. And also one thing they said is neighborhood speed management program will get more applications because people will actually see that lower speeds are good for their neighborhood. I think that's a great problem to have, and we'll worry about that next year when we get to it. 73 neighborhoods have applied for the neighborhood speed management program. It really shows that people want slower speeds on their neighborhood streets. Thank you.
Thank you, Stephen. Last speaker, William McGrew.
You may speak.
Can you hear me?
Yes.
Okay, great. I'm Will McGrew from the city of Boulder, and I'm also speaking for Newer. We here at Newer consider ourselves fortunate to live in a city that recognizes the value of direct democracy, and we're grateful that council has prioritized setting up an alternative petitioning procedure in response to the coronavirus pandemic. City staff has put together a proposed ordinance to allow for electronic signature gathering. In broad outline, this ordinance seems like a workable solution, but there are several concerns we have about the ordinance in its current form. Firstly, and most importantly, the current signature verification scheme would almost certainly disqualify every ballot initiative. The plan is that signatures are validated by contacting 100 of the signers through telephone or email, and all signatures are accepted only if at least 90 of those contacted confirm that they wanted to sign. If the signer does not respond, this is counted as a negative response. However, many people don't answer their phone when called by an unknown number or respond to emails from senders they don't recognize. I would not be at all surprised if there was a response rate of less than half. Non-responses should not be counted as negative responses. Secondly, the ordinance mandates that voter ID numbers be collected, though this is not mandated for in-person petitioning. As we understand it, this was proposed to reduce the labor required of city staff in verifying the signatures. While we are sensitive to this concern, we feel that it is unduly onerous to require signers to look up a voter ID number, which most people will not know how to find. This may also cause issues of accessibility for less privileged residents who lack internet access, particularly those who sign up over the phone with petitioners. Thirdly, the ordinance suggests that all signers' information be posted publicly, and we view this as an unnecessary invasion of privacy, which should probably be avoided. Finally, given the break in signature gathering that was necessitated by COVID, it seems appropriate to extend the deadline by 6 weeks, assuming the ordinance is adopted on May 5th. Thank you for considering our suggestions. We're not looking for a handout. We just want a fair shot.
Thank you, Will. And that concludes open comment. So I want to take a moment to thank staff for making this happen. I mean, I know it's not easy to adopt a new platform yet again and to be able to get everyone in. So let's start with staff. Does staff have any response to open comment?
No, not from the city manager's office.
Nor from the city attorney.
Great. And turning now to council, I see Junie Joseph has her hand raised. Junie?
Hi, thanks. I have a question. Can you see me? No.
No.
Can you see me now? Okay,
yes.
great. I have a question about some of the comments that were made. There was a comment about the name of people being added to the website. And I wanted to know if that's a procedure that we also do for paper ballots.
So Junie, no, although paper ballots are available to anybody who asks for them. So we're going to discuss this later. I have a full presentation, and I expect council to have a full discussion on those issues later, if that's okay.
Okay, that's fine. And I think as well, I'm not sure if you can answer that for me now, but I did find Mr. Lawrence's comments slightly stressful. And also I was wondering, he's been coming to council quite often and having the same speech, and I'm still not fully, I don't understand what he's asking for. And I wanted to know if maybe you could tell us, you know, what his conversation is about, because I would imagine people in the community are wondering the same thing as well, because he's talking about, he's feeling a sense of injustice. And I just wanted to hear, you know, where was that coming from? It could be from, you know, of course, as a new council member, we've inherited things that we didn't know about. But to me, I just find that I wanted to know more.
So Mr. Lawrence was charged with obstructing and resisting when he interfered with an arrest, or actually it wasn't an arrest. Officer Waylon Lolatai was responding to a complaint about a large group of people who had gathered at the Mapleton Fields. 3 of them were sitting by the bathroom, and he went to talk to them. They were having a fairly peaceful conversation. In fact, one of the individuals offered the officer a cup of coffee. Mr. Lawrence came and stood next to the 3 of them. He was at the time carrying a 4-foot-long staff that he claimed he needed to walk and wearing sunglasses. Officer Lolatai repeatedly asked him to step back or put down the staff. Officer Lolatai was by himself at the time. Mr. Lawrence refused. Officer Lolatai told him that if he did not step away or put the staff down, he would be arrested when backup came. Backup arrived. The backup officer also asked Mr. Lolatai to step back or put down the staff. He continued to refuse. This interfered with the investigation the officers were trying to conduct. They did arrest him. He resisted arrest, fought violently. He skinned his knees. He was taken to the hospital. He purportedly had a seizure in the hospital. A nurse on the videotape tells him he's not having a seizure, that he's faking. Mr. Lawrence claims that he was injured in a workplace accident that occurred at a marijuana business. He applied for workers' comp, never submitted any medical evidence, and the judge found that he was not credible. There's a videotape of the incident that shows that he was not, in fact, injured at all in the incident. He comes he apparently believes that none of these facts are true. They are. Officer Waylon Lolatai is an excellent officer who does a great job. I believe that Mr. Lawrence picked him out. Officer Lolatai is a person of color. He in fact suffers an immense amount of abuse himself because of the color of his skin. Mr. Lawrence, I can't quite explain why he seems obsessed with the city council. I do not believe he is telling the truth. And I'm happy, actually, I will add that after this incident occurred, council requested that we have an independent investigation done of the police investigation of this incident. We hired the same investigator we hired for the Atkinson matter, who was chosen by Mr. Atkinson's lawyers. He found that the police investigation was absolutely appropriate. I'm happy to provide you with that report. We have the videos of the incident. They're really, and I can also provide you with the judge's ruling in his workers' comp case. And I believe we even have the video.
Thank you. So essentially you're saying the issue has been resolved in some way, shape or form.
I'm not sure what else we can do. As I said, he was charged with resisting and obstruction. The district attorney prosecuted the case. He was offered a restorative justice program. He participated, successfully completed, and the charges were ultimately dismissed. I'm hoping that he moves on with his life. This is not healthy, and I do really regret that he spends so much of his time attacking an officer by name who is a very good officer and serves the people of this community very well.
Thank you.
Okay, Rachel.
Thanks for that, Tom. I was going to want to address Sammy's comment as well. I heard a lot of pain from him tonight, and I'm hearing what you're saying, Tom, but I think that there is such an inherent power imbalance in the criminal justice system. And what I see Sammy asking for is essentially an opportunity for us to hear him and listen. And it's so easy for us to get our own side of things. And it's harder to get an audience from his side. So I for one, am willing to give him a more robust or just more time to communicate with us. And I agree that it doesn't sound like he's healthy right now. And if we can help him to heal, I would give him the audience. I already meet with community members all the time. I know that it's a problem for more than one of us to meet at once, but I would be in favor of giving him the time. He went through something traumatic with our staff, and I'm sorry that he's hurting so much. Thanks.
Great. Anyone else on council? Okay, very good. You're on mute, Lynette.
Your next item is a consent agenda. You have items A through F before you tonight.
Very good. Any council member have any comments on the consent agenda? If not, may I have a motion?
I move the consent agenda.
Second.
Okay. Is this a roll call vote, Lynette? Okay.
Would anyone like to speak to the motion? Okay, we begin with Council Member Friend.
Yes.
Joseph?
Aye.
Nagel?
Aye.
Rutlick?
Yes.
Wallach?
Aye.
Weaver?
Aye.
Yates?
Aye.
Young?
Yes.
Rocket?
Aye.
The motion passes unanimously. Your next item tonight is under matters from the city manager. The 20 is plenty discussion.
Yes, thank you. And Interim Transportation Director Bill Cowron will present this matter to council. Bill?
Yes, good evening, members of council. Can you hear me?
Yes.
Great. So we are here this evening to get some direction from City Council about how we should move forward with Transportation Master Plan Action 1D, which is to explore reducing the speed limit on residential local streets from 25 miles an hour to 20 miles an hour. Our presentation this evening is going to be given by Ryan Knowles, who is our transportation planner, who amongst many other things, runs our neighborhood speed management program. And then we will hear from our Transportation Advisory Board Chair, Tila Duhaime. And then we would be happy to answer any questions and most importantly, receive direction from you. If you could, Ryan, do you already have control of the presentation?
Can you hear me now? Yes.
Yes.
Okay, great. I believe I can advance. So I'm Ryan Knowles. I'm a transportation planner in the Transportation and Mobility Department here at the city. And I'm going to be talking about the 20 is Plenty residential speed limit project this evening, and also ask our TAB board chair, Tila Duhaime, to weigh in on TAB's perspective as well. And it doesn't look like it's advancing. Oh, there we go. So why is this important? So we know that higher speeds result in higher crash severity. So the faster a vehicle is going, the more severe a crash will be, which is dangerous for our neighborhood streets. And so we are exploring 20-mile-an-hour speed limits in our on our local streets in our neighborhoods to improve safety and really to improve comfort for all roadway users. So part of the purpose of the Neighborhood Speed Management Program and really this project is we want to promote residential streets as shared spaces. We want people to feel comfortable walking and biking and really recreating and treating their neighborhoods as high quality places to live. And so like Bill said, the Transportation Master Plan identified 20-mile-an-hour speed limits as a priority item. And so that is why we're before you today. The Vision Zero Action Plan also identified 20-mile-an-hour speed limits in actions 25 and 29 as something that we would like to be implementing through the Neighborhood Speed Management Program and the Green Streets Program. So what we're proposing is evaluating and implementing the speed limit as a tool in reducing vehicle speeds in residential areas. The question we have really is that tool best a policy tool, an engineering tool, or some combination of the two? So the overall goal that we're working toward here is to have people actually drive 20 miles an hour on neighborhood streets. And so we have three options which we think will advance that goal. So option one is a comprehensive 20 is plenty study, and I'll go over the components of that in a moment. Option two is to amend the Boulder revised code. So that's the default speed limit that's currently 25 miles an hour unless otherwise posted. And option three is an abbreviated version of option one that we're proposing in light of the COVID-19 situation. So the components of option one are to pilot 20-mile-an-hour zones across the city. So to basically do between 20 and 30 20-mile-an-hour speed limit zones citywide in all neighborhoods, or in neighborhoods across the city, not in all neighborhoods. Also to look at what other cities have done. So to use the best practices we've seen in cities like Seattle, Portland, and Cambridge, Massachusetts. We've already reached out to some of these cities and had pretty good discussions with them. We're also looking at doing a statistical survey, really to get a good idea of where the community as a whole lands on this topic. So we've heard a lot of support from a lot of people. And so we just want to make sure that we are hearing the entirety of the community. And then we would also conduct additional online engagement around that to make sure that there was an open forum for people to discuss the project. The timeline for this option one would be basically starting at the end of this month and going through the end of the year. And this was the staff recommendation that we took to tab last week. Option two would be to amend the Boulder revised code. So that is Title 7, Chapter 4, Part 58. And so again, that says that the speed limit currently is 25 miles an hour unless otherwise posted. And so we would amend that to say 20 miles an hour unless otherwise posted. We would then basically go out to all the local streets in the city and replace existing 25-mile-an-hour signs with the Vision Zero 20-mile-an-hour signs that we installed on 13th Street. And we would accomplish this by the end of summer 2020. So some considerations for this option. This is a policy approach. So we would have to amend our programs to implement the policy. We are unsure how effective signing 20 miles an hour on streets will be in an action of itself. So that's why we were proposing the option one, doing the more robust study. We also see short and long-term impacts to the neighborhood speed management program. So specifically, with no changes to the way in which we prioritize projects, we will have more projects with the same amount of resources. However, this is the quickest implementation of 20 miles an hour in neighborhoods. And then option three, again, is a abbreviated version of option one. So it's really just the pilot of the 20 mile an hour speed zones in neighborhoods, as well as a technical analysis of that pilot. So determining what effect that signing has on actual speeds that we observe in those neighborhoods. And so we're proposing this because we are facing some very significant budget constraints with COVID-19. And so the timeline for this would be, again, starting by the end of the month through the end of the year. And then we would come back to council with the findings from that pilot and report and ask for guidance in terms of either completing the rest of the components of option one or moving ahead with an action at that time. So it would require additional work in 2021. So the costs of these three options. So option one is the highest cost of the three. And that again is the pilot program with an industry review, also analysis of crashes that occur on local streets citywide, and then the community survey and engagement. So in 2020, that will cost a little over $100,000. Option two, which is changing the default speed limit to 20 miles an hour, unless otherwise posted, will cost $65,000 in 2020. And again, that includes switching about 465 25 mile an hour signs to 20 mile an hour Vision Zero signs. And then option three is the cheapest in 2020. However, depending on the findings of that pilot and study, we would either proceed with the rest of the costs of option one, or we would move to implement signing citywide, so doing the default speed limit change, which would add an additional $60,000 in 2021. We brought these options and the staff recommended option to TAB last Monday on April 13th. And up to and including during the public hearing at TAB, we heard very strong support for option two. We did not receive many comments in support of doing nothing. So we didn't hear a lot of opposition, which I think is pretty consistent with what council has heard up to this meeting. TAB unanimously recommended option two moving forward. And I would invite Tila to weigh in on TAB's perspective at this point.
Thank you, Ryan. And I'm actually really glad to hear you and see that you're still on deck. You are one of Boulder's best and brightest. It is unusual for TAB and staff to lock horns this seriously. And so I think it's worth stepping back and looking at why this ordinance change is even on the table for City Council tonight. As Ryan mentioned, it's in the TMP update, the Vision Zero Action Plan as well. The Vision Zero Action Plan was developed as part of the TMP update over the past year of intensive community engagement and public outreach, mostly done by City of Boulder transportation staff. And as a result, we have a 50-point action plan that finally put some ideas and meat on the bones of what we meant behind a system-wide effort to eliminate serious injury and fatal crashes in the city of Boulder. Many of those action point items directly affect those very serious crashes, and a number of them are supporting efforts. And this is one of the quick but high impact supporting efforts. So I just want to step back and realize that this overall Vision Zero action plan is addressing a public health emergency that we have been grappling with for a number of years. Traffic violence kills about 40,000 Americans every year, about 600 Coloradans. And fundamentally, the reason that staff is wanting to evaluate this as a tool is, I think, out of a skepticism that doing this step, although we recognize its high impact and part of the system-wide change, is probably not going to directly drop the numbers that we're aiming for, which can vary from 0 to 8 in just any given year in recent history in Boulder. So the reason that we've approached Vision Zero the way we have and that other Vision Zero cities have is because going the way that we've gone for the last 25 years, troubleshooting a particular problem spots doesn't work. We need a system-wide change. And I think that Ryan was really clear, both at the meeting and clearer tonight, both at the TAB meeting and clearer tonight. We need some direction from council about whether we should be viewing this as a policy change or if it is an engineering tool to be tested. And TAB's recommendation, I think, was an endorsement of the former, that it is a policy change. It's fundamentally a statement of what the rules and expectations are for drivers on our roads and on our local roadways. And that kind of policy change and policy statement, that's your wheelhouse. That's what council is for. You guys set the policy, you are our legislators. If it's a tool to be tested and evaluated by our traffic engineers, they're going to approach it the way that they did with option 1. They're going to weigh it against data and try to count changes to tell if it's a useful tool. And so it kind of does matter what we think this tool is supposed to be doing to be able to evaluate whether it's useful. I would argue, and I think that TAB's approach and TAB's recommendation springs from a recognition that we find value in system-wide changes and system-wide statements about community expectations, and that if we expect any one of those Vision Zero action items to stand on its own and independently move the needle towards zero traffic deaths, we probably would never enact any of them. We almost certainly would never enact any of the 30 bottom of the 50 action items. So that can't possibly be the way that we are expecting our community to proceed. So TAB made its recommendation plain and simple, just to proceed directly with the ordinance change. We all agree that in isolation, this one change probably wouldn't lead to measurable impacts on fatal and serious injury crashes anytime in the near future. But that's not the intent. Now, we considered quite seriously at the meeting packing in our commentary and our feedback about whether we should be doing data collection or whether a pilot study was a good idea or whether we should engage a survey firm. We had broad consensus on TAB that none of those were a good idea. And also clear consensus that the kinds of peer city review that Ryan mentioned and reaching out and learning from other cities who have adopted strategies of system-wide reducing speed limits, that was a valuable thing to continue doing. But we left that out of the formal recommendation just to make it as clear as day. We think you should proceed with the 20 is plenty ordinance change. I'm happy to fill you in on the board's discussion on those other points, but really what we wanted to get was this is a great time and an important time, and in fact, in light of COVID, a critical time to be acting and proceeding apace instead of doing some more public outreach on top of the stuff that we've done for over the last year on the TMP update and the Vision Zero action plan. I should also note that the TAB meeting last week included a public hearing. I understand that a number of you have received a lot of the same emails that TAB did. That's been the bulk of the public feedback that we've got. We've gotten more than 50 very thoughtful emails from a number of individuals, including people with extensive urban planning, community organizing, transportation related efforts like this for public safety. But we've also heard from larger groups like Cyclists for Community, Community Cycles. The Pedestrian Action Committee submitted a letter. That group is a continuation of the Pedestrian Advisory Committee that the City of Boulder itself convened, vetted. We had more applications for that group than we could accommodate. Those people were involved month in and month out over the last year on the Transportation Master Plan update, and were so enervated by their work, they wanted to continue and weigh in on this, all solidly supporting this effort. And then, of course, Bicycle Colorado weighed in last night, meaning that people at the state level are watching what we do, and nationally, they're watching what we do. Boulder's continued to be a leader. We are falling behind in some respects, and we probably will by pausing and stopping and thinking and analyzing even further what is at base a very simple ordinance change. I think that this could be a very big safety win for us, especially at a time when it feels like we only have bad news. It could feel like something positive and proactive that the city is doing. And it's in fact a unique chance right now for the city to set a new normal for how our neighborhood streets should operate. I think that's really at base the reason we should be viewing it as a policy change and not an engineering tool to be weighed against crash data.
Tila, thank you. Bob Yates has his hand up. I assume he wants to ask a question of either you or the presenter.
Great.
My question's for staff, so if Tila wants to finish up, go ahead.
Okay,
great. I just wanted to note that TAB has also discussed that we would have made the same recommendation even if COVID were not a factor. That's the reason that we listed the TMP update and the Vision Zero Action Plan in our formal recommendation before COVID. But that the COVID crisis emerged as an additional reason to proceed with option 2 based on the benefit to public health, the relative low cost of just proceeding with the ordinance change and changing the signs as we could afford to do so, myriad data collection problems posed by COVID-19, and the rare opportunity to reset public expectations that are effective right now. I would like to close just by saying that if council proceeds with an ordinance change, we have some time built into the system to continue the public outreach that we've done, to continue the peer review that staff has already started. But that the public engagement side of things, I think, should be something that should be tasked more to TAB and to the public groups that have weighed in and support and tried and volunteered to help and are really excited about advancing this proposal. It's not transportation staff's expertise to be doing the public outreach. It's not something they're terribly comfortable doing, and they have a whole bunch of other things that are quite important on their plate right now. That's the substance of TAB's feedback for City Council. Thank you.
Great. Bob, do you want to ask now or let the presentation finish?
I can wait till the presentation's finished. I have a question for staff.
I have a question for Tila.
Great, Mary.
Thank you, Tila. Thanks for your presentation and for your email. Ryan, during his presentation at the beginning of it, said that the goal of this project is to have people drive 20 miles per hour. What does TAB view the goal of this project as being?
Yeah, so just to be clear, staff, TAB, the community, everyone agrees life would be better if drivers drove 20 miles an hour or slower on residential streets. I looked at the Vision Zero Action Plan. There are 5 objectives in the Vision Zero Action Plan. The first objective and the first 20-ish items of the action plan directly talk about reducing serious injury, crashes, and fatal crashes. Those are the critical things that we're looking for. And the next 2 objectives are increasing safety and comfort, just having people more comfortable be on their roads, increasing awareness, of Vision Zero objectives. And the 20 is plenty items come under those two later objectives. So they don't directly serve the goal of reducing serious crashes and injuries. And in terms of whether just changing the rules is going to change behavior, our experience has shown that that's not true. That's the whole point behind Vision Zero, is that you have to do a whole bunch of things at once. I like to think of the analogy as having your car stuck in a snowbank, right? Driving normally like you would on a summer day does not get you out. You have to use other strategies, as many of them as you have the resources to employ. You can shovel snow out from under the front of the car, under the wheels. You can have your passengers get out and push. You can put it in four-wheel drive if you have that available. You can throw something under the tires to increase traction. But any one of those all by itself is not going to get your car out. You've got to do a few things at once. And 20 is plenty is one of the few things at once to sort of reset the expectations for how we drive citywide. And it's one of the high impact items because it's one of the few that affects every city resident basically right outside their door. So that's, we fundamentally disagree on whether it will work or what the point is. And that's why we're looking to you. Is it a policy? Is it a statement of what we expect our city to be like? Or should we analyze it like we do other tools like a speed bump?
Yeah, so to continue the car in the snowbank analogy.
Sure.
You ultimately what you want is to get out of the snowbank.
Right.
And what the tool that finally gets you out, you may pay more attention to that in the future. So I guess I didn't hear if TAB thinks that the goal is as Ryan stated it, or TAB sees it as a different goal.
I think that Brian and the city staff are assuming that the goal of 20 is plenty, changing the speed limit, is to slow drivers down on residential streets. I think that we agree that that is a goal. I think that what staff's approach is assuming is that this change needs to demonstrate it will advance that goal all by itself. And we are saying it is part of a package of things that need to happen sort of all at once to get everyone to slow the heck down everywhere.
Okay, thank you.
Great, Ryan?
Yes.
Are you finished, Tila?
Yes, thank you.
Ryan, do you want to finish?
So my next slide is actually the discussion slide. So I'm free to answer any questions that you have.
Very good. Thank you for the presentation. Love your graphics, quite nice. And then I would turn to Bob.
Thanks. Tila, first of all, thanks so much for being here or being with us tonight, and thanks for TAB for taking this on. I really appreciate that very much. My question is actually for staff, probably for Ryan. Ryan, you mentioned that several cities have already adopted 20 is plenty, like Portland, which has about the same density as Boulder, Cambridge, which has about the same population as Boulder, Seattle, some other cities. And I'm trying to understand what it is that would be studied either under option 1 or the abbreviated study under option 3, because if other cities have already implemented this, presumably they have real world experiences. They may have even studied it prior to implementing. I don't know if they did or not, but we have real world experiences in cities that have adopted this over the years. Do we think that drivers in Boulder are different than drivers in Portland and Cambridge, and that we would learn something different here than they've experienced in real life?
I don't think we think that drivers are different in those cities. I would say, and I'll ask Bill to weigh in after I answer. The city of Seattle actually took a similar approach before changing their default speed limits in residential areas to the one that we proposed, where they did do pilots and studied the outcomes of the data they collected and looked at crashes and things like that. My understanding from speaking to staff in Portland and Cambridge was that these actions were done from a policy perspective. And so they have different relationships with their state legislatures than we do. So for example, Massachusetts isn't a home rule state. And so they had to lobby for actually to get the power to change speed limits. But I would say that the value in studying the effect of lowering the speed from 25 miles an hour to 20 miles an hour on specific streets is that we can see the characteristics of those streets, and there are varying street widths and different contexts throughout the city of Boulder. Some streets are wider, some streets are more parked up, some streets have higher residential densities. And so from an engineering perspective, it would be really useful to know exactly where those things contribute to slower vehicular speeds as drivers travel on those streets. And from a budgetary perspective, then if we knew that a certain level of signing were actually effective in lowering drivers' speeds on those streets, then that could have big implications for traffic calming going forward. I mean, if it's a difference between aggressively signing a street with Vision Zero 20 mile an hour signs or building a series of speed humps, there's a real cost associated with that. So I think, you know, one of the values of doing the study is just learning about what is effective in different parts of the city on different types of streets.
What did they learn if Seattle followed the model of testing and evaluating first, and then ultimately adopted 20th plan? What did they learn, and do we think that what they learned is going to be different than what we learned?
So I'd have to follow up with them. I can get you a better response on exactly what they learned. I mean, I do know that they have a residential speed limit of 20 miles an hour citywide. And so I would assume that what they learned was that it was something the community wanted. They have an interesting, so one thing they did part is that streets that are 25 feet wide or less and that have a decent amount of on-street parking, they found that typically traveling speeds were at or below the speed limit. So the 85th percentile speed, which is kind of the benchmark for what we look at in terms of speeding, was typically at the speed limit or below. And so on those narrower streets, they really deprioritized traffic calming and reprioritized it towards streets that are wider, have no curbs, have less on-street parking. And so that was a finding from that.
Sounds like they may have saved us $100,000. I'm done.
Okay, so this is questions. I have Adam, Mark, Aaron, and Mary. So Adam, you're up.
Thanks, Sam. My question is actually about the signage itself. So something that struck me is while the newly designed signs are really, really pretty and they draw a lot of attention, the cost of it, especially right now, seems super high. So I was wondering if we could have essentially the same product if we just use something like a really high quality vinyl sticker to put a 0 over the 5, maybe you know, a little extra yellow around the sign or something along those lines. But not only would that save from a resource cost when it comes to having a bunch of 25 signs that we can't use anymore, but it might also save on staff time putting them up, because it would be a faster process than manually uncoupling all those signs and recoupling the new ones. So I just wondered if that was explored at all and what the thoughts were on that.
I'll take this one, Ryan.
Okay, I thought you would.
So yes, we certainly could do that, and it would be less expensive to try and modify the existing signs with some kind of sticker. It, I will just say that it's they don't tend to look very good that way, because what you wind up seeing at night is a really bright O or 0 that looks quite different from the rest of the sign. But most importantly, the design of the 20 mile an hour Vision Zero sign had a variety of things built into it. The orange coloration around the edge was put there to draw attention to it, because again, where I think TAB and staff agree on this is that where there could be value here is in educating the public about what we're trying to accomplish with our Vision Zero goal. And so drawing attention to the sign with that orange background, we thought had value. And then getting the Vision Zero message embedded in the sign itself, so that when people saw that, they would see Vision Zero. We thought there would be value to that as well. So again, I think we're going to all have different opinions about how valuable this is going to be in terms of meeting our travel safety goals. But I do think that the cost to use these particular signs and to put them up immediately, if you decide to go that route, rather than putting that off, as was, I think, generously suggested by Community Cycles today. I think it would be worth that money if you believe that this is something that we should do. We should use these signs and try and get the outreach benefit of that.
Thanks for that, Bill. I just wanted to make sure all the holes were poked appropriately. And that doesn't change my thinking at all on what I feel about the program itself. So just wondered.
Yep.
Great. And then I've got Mark, Aaron, and Mary. So Mark.
Bill, a question for you first. Do we have any data as to what percentage of accidents and fatalities in Boulder actually occur on the residential streets that will see their speed limits reduced?
Yes, there's a considerable amount of data that's in our Safe Streets Boulder report that speaks to this. I guess the way that I would describe it is that on local roadways where we would deploy this, we have, over a 5-year span, we have seen one crash that had a severe outcome where somebody was injured or somebody was killed, in this case injured, as a result of speeding. That particular crash also happened to involve alcohol, distraction, and it would not have been something that would have been mitigated. So, you know, when I looked at all of the severe crashes that have occurred in the city and did this assessment, I could not find any that would have been mitigated on these types of streets in that time period. It's not to say that we don't have a problem with speeding, because we have lots of severe crashes that occur on our arterial roadway. And I would also agree with Tila that it's not just about crash reduction. I mean, there is benefit to, if we could actually get people to drive 20 miles an hour, there would be benefit to making people feel safer and feel more comfortable walking and biking, and educate them about the program. There is real benefit to that. But to your specific question, no, it would be pretty hard to improve upon what we have on our local roadways right now in terms of severe crash reduction.
Mark, let me colloquy on that real quick. So Bill, how about total crashes? Because there's one thing which is the injury crashes, and I've seen injury crashes in neighborhoods, but they often involve stop signs and people,
That's correct. Yep.
But how about total crashes? Because any kind of crash is a bad outcome, right? It's bad from property damage. It's bad from, people get scared, that you being in that place on that roadway, whether it's on a bike or whatever, could get you hit. So how about total crashes on neighborhood streets?
Yeah. We certainly have property damage crashes that occur as a result of speeding. We had a really prominent one recently where somebody was intoxicated, going extremely fast, and crashed into the Walnut sign that's over on Walnut and 17th, and completely took it out. And knowing exactly how many of those crashes there are compared to all the other crashes would be part of the analysis that we were proposing to do. I think what we could tell you just by proxy is how many crashes, speed-related crashes we've seen when we've studied the neighborhoods that have applied for the neighborhood speed management program? Ryan, do you have those numbers?
Yeah, so since the program started on local streets, we have found 2 speed-related crashes out of what would be the 16 simple projects that we've completed.
Okay, and so that's just 16 relatively short segments of local roadway, is that right?
Yes.
Yes.
Okay.
So we also have a complex project list, which are mostly collector roadways. And I think off the top of my head, we've, I think, seen 3 to 4 speed-related crashes in the past 5 years on those 17 projects. So again, we're not seeing a ton of speed-related crashes on residential streets.
Great. Mark, back to you.
One last question, I guess. People who speed are not really going to fear the posting of a few signs going, saying 20 instead of 25. People who are not respectful of their neighborhoods speed today. You're not going to have any speed traps set up on residential streets, as you might find on Baseline or on Canyon. If those people are going to continue to speed, I'm just not sure how much benefit we're getting for the expenditure of money under any of these options.
Yeah. If I could, so I do feel like we have a lot of experience trying to change people's behavior just with speed limits in our community. We have never been successful doing that, but what we have seen then what comes from that, and ultimately you can get there. And I think that this is probably a bit of what Tila was referencing. It doesn't happen all at once. It happens over a long period of time and after spending a lot of money. But if you set these lower speed limits, you will not get people to significantly change their behavior based on them, but you will have set a different expectation, especially a different expectation in the community, in the neighborhood. They will want people to drive slower. They will come to the city and say, we want speed mitigation on our street. And over time, you will put that speed mitigation out there. That is what has happened on streets like Pine, Balsam, at one time, Moorhead. I guess really it's just something for council to understand and be okay with, that the path that this takes you on could potentially take you to that place where people are driving 20 miles an hour, but it isn't going to come from posting speed limit signs. It's going to come after you've posted the speed limit signs, and then after we've gone out over years and built traffic mitigation out there.
Thank you.
Great, thank you. And then Mary, you're next. And then after that, Rachel.
So the speed limit was changed on 13th Street a couple months ago, I believe.
It was.
Do we have any data on what's happened since then compared to what happened before?
We do not. We have not collected any after speed data out there. And unfortunately, we're not in a position where any reputable data could be collected.
Okay. And in the 20 to 30 neighborhoods that have asked for the neighborhood speed mitigation program, would you, if you put the signs in those places, would there be any data collection that would occur in the post putting up the signs?
Yes. So That's actually the point of using the neighborhoods that had already applied for the neighborhood speed management program that didn't qualify at the 25-mile-an-hour speed limit, is that we had already collected data as part of that application. And so we have before data, we can post the signs, collect after data, and then see if in fact there is a difference in the speeds pre and post sign installation.
And Mary, just to, I just wanted to clarify because I just saw a text from Ryan. Ryan, is it your understanding that pre-COVID, we actually did go out and collect speed data on 13th Street?
Yeah, I know we were in the process of it. We'll have to follow up with Mark on if it was completed before the stay-at-home order.
I would just like to clarify quickly though, if I could.
Okay, go ahead.
Thank you. That the 20 to 30 neighborhoods who've applied in the NSMP, because of the way you have to petition your neighbors and meet a certain density of those petition signatures, most of the test neighborhoods, they were on the slide that Ryan showed, they're generally 1 or 2 blocks long. There are a few exceptions that are longer, often where Ryan thought, there are a couple here that we should connect and kind of see how the whole corridor operates, but these are not neighborhood tests. They're not even end-to-end corridors. The bulk of them are just testing a block or 2. And that is one of the limitations on the data collection and analysis that TAB objected to as being useful, because I don't think it would be.
Okay. And so Ryan just said the opposite. So help me, somebody please help me understand the,
I would say some of those streets are shorter in nature, and we did go through the list and looked at doing longer segments, so for example, the one that pops out is 4th Street. So we had 2 separate applications for 2 relatively short blocks of 4th Street. And to us, it didn't make sense just to study 2 blocks of 4th Street. You should really study it from at least Mapleton to Calmia. And so where we went through the list and identified situations like that, we did extend the study area, and certainly we would look at extending it where we needed to get a thorough study. But certainly, there are streets in there that are shorter than others.
I would also say that there is value. Again, this might be something where we disagree, but there is value in going out and collecting data on these different streets, even just to see if there are different results on different types of streets. Again, this is similar to what Seattle did where they were able to identify that on certain types of streets, you could post a speed limit and have a better chance of getting people to drive that speed just by posting the speed limit because the street was so narrow already or conditions like that. Whereas other streets would actually require traffic mitigation if you wanted to achieve that speed. And we could collect our own local data to help inform that. The other thing I would say is that the other value in going out and piloting a bunch of different neighborhoods is it's a bit of a proxy for public outreach, because you're going out into neighborhoods and you're saying, we're going to change your speed limit from 25 to 20. And you get to hear from the people that live on that street and around that street, whether they liked that and would prefer that you do that more, or that they didn't like that and that they didn't want their speed limit to be changed. So I think it has value from all of those perspectives. But it does cost an awful lot of money to do it.
Yeah, it does. In the cities that you've spoken with who've done this, have they seen downsides?
Not that I'm aware of, no.
I've only seen, this actually got asked at TAB the other night, and at that time, I couldn't recall any studies. There was actually one, it's the only one I've ever seen, and it was a study that took place in England where they changed the speed limit. They didn't have a change in behavior, and then had lamented spending their money that way. But certainly, I think there have been more studies that have touted positive results, and I think that probably makes sense. People tend to publish things that they've done in their community that are positive. They don't tend to publish things that are negative. I can guarantee you that we did not go out and publish anything after we tried changing lanes on Folsom, for instance.
And so would we be changing the speed limit solely from 25 to 20, or would we be going in some places from 30 to 20?
So it would be the default speed limit as defined by the Boulder Revised Code, which is 25 miles an hour, unless otherwise posted. And so effectively that means most of the local streets in the city, because on higher order streets like collectors and minor arterials, there are higher posted limits, and those would require a traffic analysis and study in order to, and in many cases, some of those streets are actually CDOT owned streets, and so it would require coordination with them as well. So it would be 25 to 20 on local streets.
So this effort would change local streets, low volume residential streets from 25 to 20. But there is, I think, also some work to be done on, I'll call it equity, around the speed limits on other classifications of streets. Collectors that have different speed limits on them, or arterial roadways owned by the city that have different speed limits on them. That is certainly something that's on our work task as well, on our work program as well.
So for example, on Alpine, which is the street that I live on, that's not, the speed limit is 25. So what you're saying is on Alpine, it wouldn't change.
On Alpine, it would change from 25 to 20.
Oh, it would?
It would, but adjacent to it on a street like Balsam, that would stay at 25.
Okay, so I have that brings up another question because back when they were putting in the circles, the traffic circles, and the islands that are, so there's traffic circles on Balsam, there's islands on Alpine, and there are speed bumps on North. So 3 consecutive east-west streets have mitigation on them. So after they put the circles on Balsam, the traffic on Alpine, I remember looking at the numbers, the traffic on Alpine grew. And then after they put the speed bumps on North, the traffic on Alpine grew. So I'm wondering if could we see any kind of that phenomenon where the impact to other streets, it moves the traffic from the new street that's got the 20 miles per hour to the one that has a faster speed limit? Does it then increase the traffic on those streets?
So I wouldn't anticipate that would be the result of posting signs. I wouldn't anticipate that the effectiveness of posting signs would yield that kind of change in behavior. Where we would have to be careful about that is when we came out to do traffic mitigation afterwards. And we've taken those, we learned a lot from projects like the Whittier neighborhood and Balsam Edgewood about how to run a good neighborhood speed management complex project. And that's where we would take into account that concern and try not to move traffic from traffic circles or some other kind of impactful thing off of a higher designated street onto a lower designated street. Okay. But I wouldn't anticipate that that would come from sign-in.
All right, thank you. That's all I have.
Great, and so I've got Rachel next, but before we get to Rachel, could I ask staff to take down the presentation? Because one of the impacts of the presentation in the Zoom environment is we can only see a half dozen people. So if we can get presentation, there we go. Now we can all see each other. So
I have to apologize. I don't have a camera, so you'll only see my name.
Great, and that's fine, but others can see each other. Okay, Rachel, if you're on, if you have your questions.
I'm here, thanks. Yeah, 2 questions. One's for Bill, and then the next is actually going to be probably for Kerry Weinheimer. He's still on. The first is if we went with option 2 and just kind of pulled off the Band-Aid and implemented citywide, could we then, as financing becomes better available post-COVID, do some of the engineering studying and collect some of the data that you wanted to get to maybe make improvements, you know, in the future? Okay. And then second, my law enforcement question. Do we have data on ticketing in current 25-mile-an-hour zones? Anyone?
The short answer is I'm not sure. It would take a fair amount of research to find that.
Okay. And where I'm going with it is, do we have ready data on national and local level for speeding, stops, and tickets in terms of the ticket recipient's race? Because generally that can be racially biased. So I'm going to be in favor of option 2, but I would like us to implement it in a way that is not going to harm people by increased ticketing. So more traffic calming than enforcement and things like that. So that's my hope. I just wondered if you could speak to that at all, what our enforcement plans would be. And if not tonight, then the next time that we're talking about it.
Sure, I can give you a quick overview of our current enforcement plan. And that is that we focus most of our traffic resources, our traffic enforcement resources, on the higher speed or to roadways, enforcing violations that lead to injury crashes. So speeding, running stop signs, running red lights. I would say very little of our enforcement time is spent on residential streets with 25-mile-an-hour speed limits. We do respond based on complaints from neighbors. And most often we find that the traffic volume is very low and there are very few violations. So if you think about it, is it better to have an officer sitting on a residential street at 25 miles an hour at 7 or 8 o'clock in the morning when, and other times kids are going to school, or is it better to put that same officer in a school zone at that same time to slow people down and hopefully prevent auto pet accidents there? And I would say we would take that resource and put it in a school zone or another busier street with a higher speed limit where the result of a crash is going to result in injuries.
Okay, because you know it would be easy to ticket somebody for going 15 over, at least at first, while people are used to the speed limit being 25 and maybe going 35. We take it down to 20, then that's a hefty ticket. So I just would hope that we can find a way to roll this out long term that is not going to be heavily reliant on ticketing as the enforcement mechanism. Thanks.
Sure, and to add to that, the plan that Bill and I have spoken of for if we were to go this direction will be to use more photo enforcement, primarily to issue warning violations at first for those that are speeding below 9 miles over the speed limit. And we were retooling photo enforcement for that capability to issue warning citations instead of tickets. And that took some programming and there was some cost involved in that. But that would be, I think Bill would agree, that would probably be our primary means of enforcement for 20 mile per hour limits on residential streets.
Yep.
My kids will be delighted to hear that, Carrie. Thank you.
Can I colloquy on that, please? I just wanted to ask if in these numbers that we've gotten for each of these options, if enforcement costs are included.
No, enforcement costs or revenue are not included.
Okay, thank you.
Great, so I'm going to call myself, and I'll be pretty quick here. So the city has really good crash data across the entire city, right, Bill? It seems to me like every time we've taken a look at crash data, I've been impressed. And so we have crash data on all the 25-mile-an-hour roads right now, right?
I would say we have very good crash data, yes.
Right. So if we make this change to 20 miles an hour across the city, we're going to be running kind of a big experiment, right? We're going to be able to say, you know, are those property crashes that are happening at some rate across the city in 25-mile-an-hour zones, you know, did that property rate crash go down or not?
Yes.
So it seems like we'll, you know, this is going to run a natural experiment for us in which we're going to be able to see. I agree with Tila. There's a lot of reasons to think about doing this, but one of the side benefits of this is we will be able to answer the questions that all these people have been asking, and we can even write a paper about it and say, here's the actual impact on crashes. And, you know, if we're using photo radar, we'll even be able to say, you know, what was the ticketing rate beforehand and what's the ticketing rate afterwards, right?
That's correct.
Okay, so I'll come back to that later. And then, Tom, this is a question for you. So if there's a property damage crash and the police come out and they do an investigation, and they find that one of the parties was speeding, and doesn't the civil and criminal penalties that are potential for the person who is at fault in the crash, don't those go up the higher they are over the speed limit?
So the ticket, the citation you get goes up depending on the number of miles per hour you are over the speed limit. The civil liability would depend, of course, on the damages, and
sure,
damages at higher speed, but there's no linear progression.
So say somebody's going 40 in a 20 and they end up braking and then hitting somebody. If there's an accident investigation, they can usually figure that out, right? They do the work to try and figure out when the braking started and how fast they were going. I mean, I've seen enough investigations. It seems like there's at least an attempt made to figure out how far over the speed limit was somebody going when the crash happened.
Sam, you're out of my comfort zone. I haven't seen that many investigations of that type. I mean, usually, you know, I've only seen those kind of investigations where there's a fatality. But
okay, so Carrie, I don't know if this would happen at these relatively lower speeds. I certainly know I've seen your accident investigation car that goes and probably tries to reproduce the conditions that led to the accident, right?
Yes, but the amount of investigation we put in is going to depend on the severity of the crash.
Got it.
So if it's a serious injury, accident, fatality, you know, we can do crash reconstruction to figure out speed. If it's non-injury, property damage only, you know, we might do some skid analysis to look for braking speed, or maybe retrieve the crash data recorder and look at speed that way. But it really will depend on the severity of the accident, how in depth we go at trying to prove speed.
Got it. And it doesn't seem like that's the kind of accident that tends to occur on these roads anyway. Okay, so that's all of my questions. I'd move us into the discussion phase. I think we can keep it relatively short if we want. It's 10 o'clock, just doing a time check, and we've got one other big thing. So unless there's going to be a lot of divergence on where council wants to go, I'll open it up for discussion. I've got Aaron, and I've got Mark, and then I've got Rachel.
Thanks, Sam. I appreciate all the good questions and presentations and things like that. I would just like to propose that we move forward with the option 2. the option one involves, spending $100,000 on a study. But as Bob pointed out, other cities have done similar studies. And Mary's question was a good one, that generally that they have found only positive outcomes, or I think it sounds like the worst case is that speeds don't change a lot. But I think Tila's case for moving forward with a kind of cultural change that starts to advance us towards our Vision Zero goals by changing sort of how we interact on our local streets with slower speeds and more of shared street approach. I think the $60,000 cost for changing the signs is very doable, and we could always phase it in, over a time period if necessary. But I think this is a time for us to, build upon the successes of other jurisdictions and go ahead and move forward and get this done.
Well, I was going to call on Rachel, but she's left her post. So now we'll go to Mark. Oh, you're back. Okay, Rachel, and then Mark, and then Adam and Bob.
Sorry, I'm having serious technical difficulties. So I was asking the kids to turn off everything else in the house that's online to see if that helps. Can you hear me?
Yeah.
Okay. I didn't hear what was just said before because I was glitching.
It was brilliant. Sorry you missed it.
Yeah.
Aaron, I'm sorry.
You missed Aaron's soliloquy.
Okay, well, sorry to miss it, and I'm sorry if this is redundant. I would just say, I assume we're on discussion now.
Yes.
With questions, and assuming that that's the case, it's lovely to have this up tonight. It's a great safety effort, and it has a lot of community support, and it's a really good step forward for Vision Zero. So I think it's a good time in our lives to have something that we are mostly together on as a community, and is safety at a time when I think a lot of us feel sort of unsafe or unmoored in life. So good timing. Thank you to Transportation Department and TAB for their work on it. And to me, I can remember when I first started looking at this initiative and was just thinking, like, the teenagers and young 20-somethings that I live with were not going to be happy that Boulder was going to reduce the speed limit to 20. But then you look at the hard numbers, and it's so easy and plain to see that, if you've got a crash at 20 miles an hour and 9 out of 10 people survive that, versus 30, it's only 5 out of 10. And at 40, it's 1 out of 10 survive. It becomes sort of a no-brainer. And so for that reason, because it's got such a package of tools that we need to pass, as Tila said, to get us all the way, the car out of the snow, it's a good step forward and a great safety measure. And so for that reason, I support option 2 and just moving forward and doing the studying as we go. So that's what I'm supporting. Thanks.
Mark?
Well, I'm happy to take a divergent viewpoint. I think we ought to give some thought to option 3 for the following reasons. I think we all agree we want to get to a lower speed level. We want to have people driving a little bit slower. And I think option 3 at least provides an experiment towards getting there, where we can analyze the actual effectiveness of a program. It's the cheapest cost in the year 2020, in which we are in deep financial crisis. And I find it interesting with respect to option 2 that Boulder tends to be a very data-driven town, apparently until it isn't, because we're not using data, we're using, I think, there's a certain degree of emotionalism to do a one-size-fits-all statute when we ought to be looking a little more granularly at exactly what we're going to get out of it. We don't have good data that this is going to achieve much in the way of accident reduction on the streets in which it is going to be imposed. And I think we ought to be taking a little closer look at it at a lower cost, at least for the year 2020, and then we can decide how we want to proceed. I don't think there's any divergence in this council as to where we want to get ultimately but I just find it perplexing that we would jump into passing an ordinance with very little underlying data other than people seem to like it.
Rachel would like to colloquy.
Sure.
Thanks. Just on the data point, I think we do have a lot of data. It's from around the country and internationally, and I don't think we got an email saying every city thinks it's special, but we're not. Like, we all have the same mix of streets and the same complicated issues, and you study it in one place that, you know, it is pretty well transferable. So I like what Bob said, like, thank you, Seattle, for saving us $100,000. So I would disagree that we don't have the data. I think we've got pretty strong data from around the world.
Rachel, you may well be correct, but I will simply point out that on issue after issue, as we consider things at this council, we are always pointing to the uniqueness of Boulder and its particular characteristics. And I don't know why this would be different from those other situations. Again, you may be right, but I would want to take a look at it in a different way.
Okay, Adam?
Yeah, I'm going to go ahead and support option 2 at this time, mostly because I think that's just where we're ultimately going to get to anyway. So why not just move ahead? And I would love to know where all those sad, lonely 25-mile-per-hour signs end up after they're switched out. So,
good question. Bob?
Yeah, I'm going to join Adam and Aaron and Rachel in supporting option 2. I want to remind us that when we put together the 2020 budget, we actually added some extra money for Vision Zero. I don't remember how much it was, but it was several $100,000. And it was for just this type of project. Mark made a comment that the cheapest of the 3 options, at least this year, would be option 3. I would actually observe that the cheapest thing to do would be to do nothing. I don't think any of us are proposing that. And in the long term, option 2 actually is cheapest because option 3, as Adam just said, I think correctly, we would do it, we would study it, and then we'd say, let's do 20 miles an hour across the board. So why not just go forward now? It is, in fact, the least expensive option and probably the most effective option. And I take the $100,000 that we would otherwise spend on study under option 1, and when we feel comfortable that we are out of the woods on the budget, use that $100,000 rather than for studies, use it for education and enforcement. I think Tila was absolutely right that this is one element of a broader Vision Zero project. And we've been talking about Vision Zero for a long, long time. And I think it's time to move forward and actually do something.
Great. And I'm going to jump in here, and I'm going to also say that we should move ahead with option 2. I'm going to suggest that there are ways that we can save money and do that. So definitely we want all the arterials that enter Boulder, every road that enters Boulder from the county, we want to put the speed limit 20 unless otherwise marked, and you can make those fancy ones with the nice borders and the Vision Zero across it. But I think, you know, at the very least, you could just take down every 25-mile-an-hour sign in the city, and the speed limit there would be 20. I'm not suggesting that's what you do. The way to phase this in, if we don't want to do all 400-odd 25-mile-an-hour signs at once, would be to take them down. And replace the ones that we can afford to replace. So Mark, to your point, if the answer is that it should only be $35,000 or whatever the number was, because we're in a budget crunch, you know, you can solve that in a creative way. Adam had another creative way to solve it, which is put decals on. So I think there are ways that we could roll this out and we could end up with the signs that Bill described to us, which are nice signs everywhere that emphasize Vision Zero, but they don't have to go up all at once, because the whole point of the, you know, the default speed limit is that you don't have to have a sign everywhere. In fact, you'll find a lot of streets in Boulder where there is no speed limit sign because the speed limit's 20. So Mary?
So I like that idea of taking down the signs and then maybe just saying what I heard earlier. I can't remember who said it, but it was unless otherwise posted, the speed limit is 20. So I would like to propose a kind of a hybrid idea, only because I do feel like we need our own local data. And I think that we we want to make sure that our final decision on this is data driven. So I would like to propose that if we go with option 2, that we have that ordinance expire at a certain date, and then we've gathered some information up to that point, and then we have some data from which to say we're just going to renew it, or we're going to end it. So I would feel like we've done our due diligence and gathered our own local data that way. Just because I lived through Folsom, how's that? So that would be my suggestion. Yeah, so it's kind of a hybrid of 2 and 3.
So I've got Bob and Mark.
Yeah, first of all, I'm going to disagree with Mary's suggestion. I think if we go down this path, we're not going to go back. And I can't imagine us, changing it to 20 miles an hour, trying to teach people to drive only 20, putting up some signs, and then after some sort of sunsetting of 2 or 3 years, reverting back. I think this is a, no pun intended, this is a one-way street. Once we go down this path, we should stick with it. And we can always revisit it, of course, but I don't think we need to put a date out there to revisit it. I think future councils can revisit it anytime they want to. I do have a question, however, for Bill and Ryan. Just following up on Sam's suggestion that we could phase in the signage. I assume that a fair amount of the expense of changing the signs is actually not so much the metal of the signs, it's actually the labor to take down the old signs and put up the new ones. And so I guess I'm wondering how much savings there would be if we took down the 25s and then later put up the 20s, because it seems to me that's twice as much labor. Is that a fair assumption?
I'm very glad that you asked that question. There definitely is a sizable portion that is associated with the labor. I would also point out that if we were just to take down the signs, what we'd actually wind up doing, because we don't just leave posts sitting out there without signs on them, is to take out the posts and then potentially come back and put the posts back in. I would just reiterate my strong recommendation that if we did go down this path, then we will take some of the money that you pointed out, some of the $700,000 of Vision Zero funding that we allocated to this project. We'll put these signs up, and I think that what that will get you is the outreach component of this, where people driving around the neighborhood will see Vision Zero and will be understanding, better understanding that we're trying to accomplish that Vision Zero goal. That would be my recommendation.
Okay, I'm convinced. Mark.
I take it, Sam, that you no longer propose any kind of phasing in of the signage.
Well, no, that's not true necessarily. I mean, I don't know how long is it going to take you, Bill, to accomplish this.
You would be surprised how fast we can do this.
Okay, great.
Because I was going to be supportive of your suggestion, actually, as well as Mary's suggestion, but I don't think either of those suggestions are going to be moving forward.
So I've got 7 people who have weighed in. I'm looking for Mirabai and Judy, and then we can move on from this.
I'm kind of with Mark on this, but I think that the community has kind of spoken, so I'm fine with going with the majority on this.
Okay, and Junie? You're on mute. Junie, you're on mute.
Thanks. Yeah, I think we've talked about this at length, and option 2 is where we are. And again, the cost saving, and we're in a different time. So yeah, I support option 2.
Very good. So I think it's a clear majority who want to move forward with option 2, and I withdraw my cost saving suggestion because it doesn't sound like it would. I want to thank TAB and staff for all the work you put into this. And I look forward to seeing those new signs going forward. I think it is part of a cultural change, and Vision Zero is something we committed to. And this is an inexpensive way for us to move towards our Vision Zero goals in a cost-sensitive way at a time when that's something we need to be doing. So thank you all.
Just a process point, Sam, just to clarify, I think this is direction tonight. And I think what would happen then is I think staff would bring back an ordinance maybe in a couple of weeks for a first reading and a second reading. So that would become official sometime in May, I think.
Yeah, thank you. And I forgot to mention CAC has already put those placeholders on going forward. So we're ready to do this at the May meetings. So by mid-May, this should be a law, I think. Very good. Okay, so let's do a time check, Council. It is 10:24, and what we're looking to take on next is electronic petitioning, which I predict will be a significant undertaking because it's ground we've never trod before. I guess one thought might be to get through the staff presentation and questions and return then for another discussion. My prediction, if we try and get through the entire discussion, considering what will be there, is we'll be after 11 at least making decisions. So I just put out there, I'm happy to take feedback on how we'd like to proceed.
I'm just going to talk.
I had my hand raised. But go ahead, Rachel.
Dang it.
Well,
I did
you're in a race
sorry.
condition.
So this is so time sensitive for people who are trying to gather signatures that I wouldn't delay. I think we should, it's one where I think we should put in some longer hours because we're already up against such a major time crunch that I don't think it makes sense to delay.
Great. Aaron, Mary, Mirabai, and Bob.
Well, I have an idea. I don't see if other people would be interested in this. So I agree with Rachel about the time sensitivity about this, but the issues involved, I think, particularly in the validation of the petitions, are complicated. And I worry about us making the perfect decision late. But one thing that we could consider doing would be to authorize the collection of signatures now and finalize exactly how we would validate those petitions in a couple of weeks when we have some more time. So let people get started, but I think you can disconnect exactly how you'd validate it from letting people get started.
And then we've got Mary and Mirabai and Bob.
So I was going to bring up the same point that it is kind of time sensitive. It may not take as long as we think, but I think we need to do it.
Okay. Mirabai.
I'm fine with taking your option, Sam. I don't have much more in me. It's just hard to do this at 10:30 at night after a 10-hour workday. So I don't just have a lot of brain power left.
Bob.
I'm going to make a short substantive comment, but it does go to maybe a process suggestion. I'm going to agree with Leslie Glustrom. I'm going to repeat that again. This is probably the first time that Leslie and I have actually been on the same page. But Leslie sent us, I think, a really wise note today that while we want to encourage people to practice social distancing, that doesn't make it impossible for people to collect paper signatures. And I won't bang on about this right now if we decide to have a discussion about it, but I just want to observe that there is an option that is available now that doesn't involve us making a policy change, as Aaron says, after 11 o'clock at night when we're probably not that sharp. So I'd like to see if there's enthusiasm around the concept of staying the course and not making change. Because obviously if we decide not to make changes, we don't have to make decisions late at night or next week.
Can I colloquy on that?
Sure.
So I agree with Bob and Leslie, I guess. I do think that although up to the point where we don't need to make any changes, I think we could make some changes to the paper collection of signatures and add some distancing requirements and some safety and hand cleaning requirements, things like that, for a collection process. But we can talk about that later.
Okay. Rachel?
I'm confused about the process here, but I guess like my experience right now in the world, and I don't know that it's going to change in a week or a month, is like people are making less eye contact. They're like trying to scurry away from each other. I just can't imagine that it's going to be a similarly situated position that we would be putting in people in if we did paper signatures. I think that it's going to be a hard year to gather them, and most people are going to want to touch somebody else's pen. No matter, it's just going to be hard to trust in the current world that's safe. So again, I've never experienced that in Boulder, but people like just have their heads down and are like, it's a very unsocial, unfriendly sort of environment in a lot of ways right now. And I think that proactively approaching people to sign would be a tall order.
So let me come, Aaron's got his hand up. Perfect. Aaron, and then Mark. Here, let me put my window. Go ahead, Aaron.
Well, I want to second what Rachel said, but also that not only just that they wouldn't, but also I don't think we should be encouraging people to do that. I mean, the signing of a physical petition involves a certain amount of inevitable shared touching of surfaces, and I really don't think that's something that we should be encouraging right now.
So we've got Mark, Mirabai, Tom, and Bob. So Mark, you're on mute.
Yes, I was. I'd have to agree with Bob and Mary on this one. And as a fallback, I would agree with you about breaking up the conversation. I just don't think this is the time to start a 3-hour discussion over the procedures for electronic balloting.
Okay, Mirabai.
I'm 100% on board with Bob and Mary and Mark on this one now, and then as a fallback with you.
And then Tom.
So I'd appreciate the opportunity to at least run through my presentation. I've spent some time working with the various committees. I've got answers to a lot of their questions. And I think even if you want to start them collecting signatures, what they collect is going to be important. And just getting some feedback on that. I think I can run through the presentation in about 10 minutes. And then you can decide how much you want to discuss it after that. And then we have this public hearing scheduled in 2 weeks where you can do a deeper dive. That would be great.
That'd be great. And so just make sure, Bob, you have one more thing.
Yeah, I just wanted to build on what Mary said. We're, as we heard from Jane earlier today, first of all, we've been allowing people and to some extent encouraging people to visit our local restaurants and pick up food to go. And the restaurants have figured it out. You can go up. You have to sign. They have clean pens and dirty pens, right? And you come up to the counter, and you don't have to be close to somebody. There's your credit card receipts there. You sign it. You hand it back. People are wearing gloves. I think there's a lot of layers of protection that we can put in place. And we're now getting ready to allow that to happen in retail stores as well. So it seems a little inconsistent for us to say, yeah, stop by retail stores, curbside pickup, stop by restaurants, curbside pickup, but it's impossible for people to sign a piece of paper that's sitting on a table with a petition circulator a safe distance away. I think there's a lot of ways that this can be done. We don't have to tell them how to do it. I mean, the rules are there, but I think it's a little bit of an exaggeration for folks to say it's impossible to collect signatures, because it's not impossible for people to pick up food and other items curbside, and that's been happening throughout this, and those restrictions are actually going to be lifted over the coming weeks.
Can I do quick colloquy?
Sure.
It's just that with like the restaurant pickup, which I've been doing, it's the restaurant person touches the thing, and then you touch the thing, and then that's it. With a petition, it's a shared piece of paper potentially. So, if you give everybody their own piece of paper, then you are getting to similar levels. But if it's done with a clipboard or shared piece of paper,
or perhaps Tom,
people involved.
Yeah, perhaps Tom, during his presentation, can tell us whether it's okay if they're separate pieces of paper. I imagine that would be okay.
Okay, and Tom, just before you get going, I want to make sure. Okay, Junie, did you have something you wanted to say right now?
Yes, I just wanted to add to Aaron's point about the social distancing. I do agree with Bob, but I also want the petitions to move forward. And I was thinking as well, we want people to do the right thing. And even if we are easing, people can go out there, I would imagine that it would be hard for people who are petitioning to get access to people because we're still in the social distancing phase, and we're still telling people to stay home. So it's very hard and challenging. And I'm thinking we have to do the right thing that moves democracy forward. And if it is electronic signatures, we should just do it.
Okay, Tom, sounds like you're on.
Okay, so I asked Luis Toro to stay tonight. Luis was staff supporting the elections working group, the campaign finance working group, and he is a recognized expert in election law. There were many questions on election law. I sent you a confidential today that answered them. If you have any questions, Luis is here to help with that. I'm going to go through relatively quickly, and hopefully it's going to work. Supposedly takes 30 seconds after I press the button. Chris?
Chris, do you want to run it from the presentation screens?
Because I'm pressing the button and nothing's happening.
Yeah, Tom, I apologize. I'm not sure why it's not working for you. Let me try and advance the slide myself.
It's just karma, Chris.
No, it's letting lawyers run technology.
Well, usually we have the capability of pressing a button.
I know. Tom, some people are really good debuggers. You use them because they're the ones that bring out whatever is going to come out in the code or the hardware. So there you go.
Is it working now? Chris, can you just go to the edits? No, there it is. All right. Is that all right. So first reading tonight, this is a rough draft. Council just gave me direction to generally bring something back. The idea was that you'd have a discussion and then we'd adopt it by emergency on May 5th. It's a temporary uncodified ordinance that would expire December 31st, 2020. We plan for the 2021 election to have the online petitioning system in place. This is in the ordinance. It is a condition of approval of electronic petition signing that circulators do not engage knowingly or unknowingly in fraudulent procurement of signatures. I put that in because that gives you authority in the ordinance to invalidate something if you detect fraud. So that was one of the challenges, to make sure that there was no fraud. This is the definition of electronic signature. For the purposes of this ordinance, electronic signature means an electronic sound, symbol, or process attached to or logically associated with a record or executed or adopted by a person with the intent to sign the record. That is directly from state law. As you can see, it is a very broad definition of electronic signature that the state has adopted. You can be on the phone and say, I recognize that as my signature, and under this law, that would be sufficient. So we're giving a very generous definition of electronic signature. There is nothing in this ordinance that would require a campaign to have a particular software package or use any other tool. They could do it by paper if they wanted to, but we do have a requirement that they submit to the clerk an electronic spreadsheet with the information required. So this is the information that we're asking that they submit to the clerk: first name, last name, date signed, residence, zip code, voter registration number, telephone number, and email address. Voter registration number, you've seen some objections to. There's an assertion that that's not something most voters know, and I think that's right. However, any campaign can buy a list of all the registered voters with the voter registration number from Boulder County for $50. So they could provide it to the voter if they wanted to. The voter also, Lynette told me she looked hers up in under 30 seconds by merely Googling the Secretary of State's site to find the voter ID. You have to put in your name and date of birth, and it pops right up. So it's not that difficult. The reason we want it is we did a test. It adds about 5 to 10 seconds in the best case by putting in name and last name. It can add a lot more. By my estimation, three petitions with about 4,000 signatures each, that adds about 30 hours of work to the clerk's office if we don't have the voter registration number. So there's a big cost to the clerk's office if we don't include that. This again is a list of things that we'd be requiring. So petition invalidation. This was the council's instruction to me was see if you could figure out a way to prevent wide-scale fraud. So since we know that names, addresses, and voter ID numbers are available publicly, it would be possible for someone to create a forged list relatively easily, or to forge a number of signatures. I'm not suggesting that any of these petitioner groups would do that, but it's one of the things we've been working hard to make sure that the person who is acknowledging their signature is actually the registered voter. So this was a way, this is the 100 signature, looking at 100, selected at random, and then if 10 or more don't respond, then you're out. It's a harsh penalty, I agree, but it is a way to discourage fraud. Now, after talking with the campaigns, I came up with different language, which so I asked, since we're asking the campaigns to submit a spreadsheet with all of the email addresses, I asked the clerk's office how hard it would be for them to just email everybody, and they said not very hard at all. So the alternative proposed language would be to require the clerk to email all signators, and if more than 10% contacted did not have a valid email address or are not the voter named the petition will be invalid. So that's a much higher standard. It's more acceptable. There is still a possibility of fraud here because you could theoretically create valid email addresses by just signing up with Yahoo or Gmail or any other free email service, and it would not bounce. So we would not get any rejection. So there's still a possibility. So the other language, which is language that Adam suggested, was causing a list to be published online, and then people could check to see if their name was there, and if more than 10% said, I didn't sign it, then we know that there was massive fraud going on. There has been an objection that this invades privacy, but voter records are public records. It's not necessarily invading privacy. With paper signatures, anybody is entitled to come in and examine the paper signatures. This would be putting them online. Obviously, it's greater publication, but it's no less public information. There's also a concept that democracy should be done in the open. And there is this idea that you're supporting something, but I'm not sure that hiding the information is entirely possible, since we need to be able to provide it to folks who want to make a protest.
So Tom, can I ask a question on the previous slide real quick, which was, I assume that you've already scrubbed, before you send out the emails to everyone, you've already scrubbed out the folks who don't live in Boulder, because it's quite often the case that, some number of signatures don't actually qualify because the signer doesn't live in Boulder. So is this proposed alternative after those names have been removed?
I wasn't thinking along those lines, and I'd have to ask Lynette about her process. Checking to see if they're registered voters is a longer process.
No, well, I mean,
I would expect that they would do this right away because they only have 10 days to do this, to validate the signatures under the charter. So, good.
Once we're done, I'll ask Lynette.
Okay. So I'm sorry, we put in a disclosure requirement that they were required, that the committees would be required to inform all signers in writing that the signer's name and address will be published on the city's website. The signer's name and address and telephone number will be provided to any registered elector who requests that information. Protests, the reason for that is that people can and do file protests. That under the charter, they have to be filed within 40 days of the submission. In the ordinance, we provide that any registered voter can request a list of the list, and they must include the name, the protest's name, and the specific grounds for the protest, which is an issue we've had in the past where people protest without providing any grounds. And sometimes I think it's been done for political purposes. Committee's concerns, as I said, the voter registration number was something that was raised. Yeah, obviously, you've heard about the invalidation procedures. There have been suggestions both to increase and to decrease the number of signatures. There is a provision for security requirements that is just wrong in the ordinance that we'll have to fix. That's the securable devices. The affidavit requirement also needs to be fixed. And publishing names and addresses has been raised as well. I think you've heard all of those. That's my presentation. That was less than 10 minutes.
Awesome. So if you get rid of your presentation, that'd be great. So we can see each other. Okay. So I have, first let's ask questions and then let's have a process discussion. But I know people have comments. I see Adam has a question. I'm going to have a question. Adam?
This is for Tom. Just wondering what in the current system is the available things that you can get from the voter file. So anyone can go and get them. Is it first and last name, voter registration ID? What else am I missing?
I think that's it.
Okay. Well, there's the only things that
address is available.
Yeah, address, I was going to say.
Oh, and address is available. Okay.
Sorry.
Just want to make sure we all have a clear basis as what is currently findable by the general public.
Yeah.
And it includes voter ID as well, just for completeness, right? It's voter ID, name, address.
Yes.
Is that right, Lewis?
Yes, yes, street address, residential street address.
And does it include date of birth as well?
No, you put your date of birth in to get it, I think, but I don't think your date of birth is listed on the record.
That's right. So I'm going to ask my question, Lynette. So if you get, a petitioner brings you their signatures, what's the first thing you do with them?
The first thing we do under the current process?
Yeah, under the current process. So they're written signatures. They come. Do you weed out all the ones that aren't residents, or what do you do first?
Yeah, first of all, we get a copy of the voter registration database from the county, and we finagle that to fit into our tracking database. And then we split up the petitions and one by one go through each line, find their registration, and mark that they've signed the petition.
Got it. And if they don't happen to live in the city of Boulder?
They don't get counted as having signed.
Got it. And so do you end up with a list of people who signed the petition who actually live in Boulder, so qualified electors?
Yeah, we end up with the petition sections, we just cross out the signatures that are not good. So we don't end up with a separate list, but we do end up with the original copies of the petition with approved names on it, as well as ones that we've discounted.
Got it. And then do those end up in a spreadsheet or a database somewhere electronically?
They're in a database because that's how we track to make sure someone doesn't sign more than once. They only get counted for signing once. So they are in our database, yes.
Got it. And so then if you're going to do anything else, whatever procedures we decide afterwards, you have an electronic list of qualified electors who signed the petition.
We would under the current system, yes.
Right. And so with this electronic system, it would seem like the goal would be the same, right? Whatever format we say they have to submit in, you would be able to put that in your database, sorted by who was and wasn't a registered elector in the city of Boulder, toss out the ones that weren't, and you would end up with, you'd have the paper section and you'd have the electronic section, but you'd still have an electronic list.
That's correct, yes.
Okay, thank you. Junie?
Yes, can I make can you hear me?
Yeah.
Okay, great. Can I make comments about the ordinance and the different sections now?
I think we're in questions at the moment. So if that's okay, Rachel wants to make comments as well. Aaron, do you have a question? And Bob, do you have a question?
I have a question.
Okay, great. So I've got Bob and then Aaron.
So just in terms of publicly available information, so currently with the current paper petitioning process, those paper petitions are public record, but how are those accessible? Are those accessible online? Who signed those petitions?
No, I don't think so. Lynette?
Not to the public, only if someone asks. We didn't want to have the signatures out there.
So currently, if you want to know who signed a petition, you have to kind of come in person, or what's the process to figure that out?
They could just request it. I'm not sure how we get it to them, whether they would come in person or whether we would create a file they could look into.
Okay, so I'll come to a comment later, but just posting things online would be very different from our current practice, posting the record, name and address of everyone.
Yeah.
Correct.
Okay, Bob?
Yeah, I just wanted to ask a question following up on the back and forth that Aaron and I had. Tom, under our current system with paper signatures, is it permissible for the petitioners to deliver a separate signature, a separate piece of paper for each signing elector? In other words, there's no requirement that we have a certain number of electors on a page. It could be one page per elector. Is that correct?
I think that's right. Lynette, do you agree?
Yeah, that's right. They would have to have an affidavit with every signature, but yes.
Yes, okay. Every paper has to have the warning and the affidavit on it.
Okay, but from a safety standpoint, if a circulator wanted to not have somebody touch the same pieces of paper as the prior signer, they could have a separate piece of paper for each of those signatories, as long as they had the affidavit and the disclosure language on it.
Yes.
Okay.
That would have a lot of paper in her office.
A lot of paper.
Right. That would be a lot of paper.
Yep. Okay. Thanks.
And Adam?
Yeah. Quick follow-up question that Aaron sparked. Is there any legal inability for people to post? Imagine they get the records to post them online themselves. Like, is that currently illegal?
I don't know. I didn't know if there's a law on posting election. I've never seen one, but I can't say that I know. Luis, do you know?
Yeah, I'm not aware of that either. So, most people's voter registrations can be found online just by Googling, actually. I mean, there's nonprofits that post voter information just willy-nilly on the internet as we stand here today.
Okay, I was just trying to make sure all the questions were asked. Thank you.
Okay, so that seems to be the end of questions. I guess the one process question. So Tom, let's come back to your thoughts. You had intended to introduce an ordinance tonight on first reading and then pass it by emergency at the next meeting, correct?
That's my plan.
Okay. And what that would mean is whatever we do at the next meeting is going to be final, correct? It's going to become law and people can collect signatures based on it. But you don't need us to hash out all the details tonight. You don't need us to make a decision tonight because this is first reading. So we can take comments and then leave it at that without having to get to a decision point. Is that correct?
That's correct. My major concern was giving the community time to digest this and give you feedback in time for a public hearing in 2 weeks.
Got it. Okay. So my suggestion, and people can object if you'd like, but it's a thought, is we each make one round of comments, maybe a colloquy or two, but we don't turn this into a raging debate. We just put our opinions out there for Tom and Luis to integrate, and then we'll have time over the coming week to get community feedback over whatever our comments are. Since we don't have to make a decision, that's my thought. Is there any objection to that? Okay, great. Then if we want to start comments, Rachel, do you want to kick us off?
I can, I guess, and I will, but I have like a lot of thoughts on the signature verification and invalidation. So you want me to get it all out now, right?
May as well. I mean,
okay. And so I take it Aaron's request that we sort of bifurcate and just decide tonight whether we want to gather signatures and focus on that, and then decide later how to validate them is out.
Do you mind if I throw that? I'll withdraw that because it sounds like Sam's approach is a good one, that we can throw out our ideas tonight and then do a final ordinance in 2 weeks by emergency.
If I understand correctly, just to make sure we're all clear, you could not begin gathering signatures electronically no matter what we do tonight, because we wouldn't pass the ordinance until next week.
Right. Okay.
Great.
All right.
Rachel, I've got Rachel, Bob, and Junie.
All right. I'll launch in a little bit. First, to Bob's point about sticking with paper ballots, I I think we really have to be rational about what's possible right now. And I personally have signed a lot of petitions. And so I know what that looks like. And it's usually that you're at the farmer's market or on Pearl Street, or, you know, visualize like where Girl Scout cookies might be being sold outside the grocery store. You know, it's where people are congregating and gathering, and we are absolutely not doing that now, and we're not supposed to be doing that now. So there's no way in my mind's eye that would be putting people in an equal position to be democratic this year if we pretend that we can do paper ballots. We can't do that and with a straight face say that it's going to be the same. So I'm pretty strongly opposed to that. And also, like, if I'm going to a restaurant, I'm wanting to be at the restaurant, versus if I'm signing a petition, somebody's kind of coming after me and kind of coaxing me to do it. So you're not willing to take a pen from that person in the same way as you are if you're wanting to be at the store and wanting to make a transaction. This is more like you have to be talked into the purchase. So I think it's different, and I think we need to be sensitive to not inhibiting democracy. So then, as to the signature verification and possible invalidations, I think that most of the onus should be on the city or the collectors and not on the signers. So as an example, if we call people and then I think we've moved away from that and maybe we're going to email, but if there's any onus on the person to contact us back and the lack of a return call or return email is somehow going to be taken as it's not a valid signature, I think that's putting the onus on the wrong place. I think that if we think about ourselves, like how many of us do not return every single email or every single phone call on the city council? Like a lot of us don't return them all. So that's just going to be the reality. It's going to be coming from a number or an email that you don't care about. And so putting the onus on the signer, I think, is the wrong way to do it. And I think inaction should in no way imply that you disagree with something, the same way that if I don't respond to your email, it doesn't mean that I agree or disagree with it. Let's see. I think that we need to be sure that we're doing a statistically valid number for our vetting, and the original 100 was probably not, it was probably too low. So maybe we needed to send out more and have a lower threshold for what would qualify as invalid. If a signature is seen to be invalid, I think we need to give a chance to cure it, the same way it works with paper ballots right now. So if a signature is defective, you usually have a chance to cure it, and it also doesn't invalidate the whole petition in some situations like we're talking about. So again, I think we need to put people in an equal position, not a better position. I'm not trying to give anything a leg up, but just as good of a position as we would be in without the ruinous virus. For the voter registration number, that seems like it's easy to look up for people who would want to maybe forge something, but it would be difficult to look up if I'm signing the petition and I don't have the internet, say. So I think there's an equity issue there. So I would not have people need to provide something that they don't have at the ready, that they don't know about themselves already. I agree with the concerns about privacy for posting the signers' names. I think that might discourage some people from signing that just have mistrust and privacy concerns. So I wouldn't do that. I think we need to think about extending the deadline so that we have several more weeks, because we've sort of lost several weeks with COVID. And last but not least, I think I'm always a little bit skeptical when people want me to sign something that I haven't heard of, and I'll usually vet it. And I think this whole thing is assuming that we do it and support democracy moving forward. I think this whole thing is going to be confusing to people. And so we will need to give it an air of legitimacy by having some information on our website, having a landing page for, yes, you can now sign documents this way, and here's how they are valid. And you can trust that this is not a scam, and maybe have links to the petitioners' websites. I think that's all. Thank you for remembering to call me, Sam.
Okay, you're welcome. And then I've got Bob and Junie and Aaron. So Bob?
Sam, can I say one thing real quickly?
Sure, go ahead.
You cannot extend the deadline. You cannot change the number of signatures. Those are in the charter. Those are set. And that they were set by the voters just a couple of years ago. So I would not advise, I mean, there's a specific language in the charter on both of those things. The number of signatures was very hotly debated and was put to the voters. So I would, again, advise against that.
Sorry, I wasn't suggesting that we change the number of signatures you need to gather. I was suggesting that just for our like spot checking verification purposes, the number, just vetting 100 as opposed to 300, I think 100 might be too low. Sorry for that confusion.
Setting the deadline, which you cannot do.
I have a question for Tom along those lines. So just as we can't change those two things that you just pointed out, we also can't put a hold on the petition so that they could resume like next year.
No. If they get enough signatures, you have to put it on the ballot. And if they don't, it's invalid. The charter is pretty clear.
So it's a charter thing. So we can't, okay, great, thank you.
You have no choice.
And there's a, Tom, when you and I talked offline today, there's a 6-month staleness period, right? A signature is only valid for 6 months after it's collected.
Yes. That's also in the charter.
Okay. And then I've got Bob and Junie and Aaron. And Mary, are you in the queue for speaking later? Anyway, go ahead, Bob, Junie, and Aaron.
Yeah, so I'm going to vote against this both on first reading and second reading. I don't think we should advance this, and I'll just rattle off a few reasons why. As we've seen here today and in the email exchanges we've gotten, and we've gotten some helpful advice from members of the community who've done some math for us, this is going to be very fraught and complicated, and I'm afraid no matter what we do, we're going to somehow get it wrong, or at least somebody's going to think that we got it wrong, and this is going to end up in litigation. And so we have a system that works. It's a paper system. And if I were a petition circulator, these folks, it sounds like they have long lists, and they're hoping to get people to sign up by sending them emails and circulating that around. If I was a petition circulator, I would use that email list that I have and say, please come to the park at 2 o'clock. There'll be a table there. There'll be a circulator there to supervise. He'll stand 6 feet away. We'll have separate pieces of paper, and you can sign it, and they can ask questions. And that, like I said, that's happening right now already with restaurants, and will soon happen with retail establishments. So I think to say that it's impossible is not accurate. I think the best we can do is get something which is going to be imperfect and will probably be subject to litigation teed up 2 weeks from now. If I was to provide advice to these, I guess there's 4 groups now, I'd say that their time is better spent over the next 2 weeks going out there and getting signatures, and not hoping that 2 weeks from now we're somehow able to cobble together an imperfect system that they won't know will actually work or won't be subject to some sort of legal scrutiny if they actually get on the ballot and pass their measure. So if I was the leader of one of these groups, I would actually figure out how to get this done by paper and spend the next 2 weeks collecting those signatures, and they have all the way up to June 5th. And matter of fact, of the 4 petitions I understand, 2 of them are actually charter amendments, and Tom has advised us that the charter amendments actually have until August. So those folks, well, there's a second one that's been pulled. That's also
right.
charter. So two of the 4 are actually charter members, and they have until August to collect their signatures by paper. And one of the ones that's not a charter amendment has already indicated to us that they've already collected more than half the signatures they need, and so they're well on their way. And then I'll just close by reacting to Rachel's comment that we not inhibit democracy. We're not inhibiting democracy. COVID has inhibited democracy. This has been the system for decades. This paper system's been in place for decades. And no one said that the paper system that we had before inhibited democracy. And I'm sorry for the petitioners that they ran into COVID, but COVID has hindered a lot more than democracy. COVID has hindered people's lives and livelihoods and homes. And so it's unfortunate that they find themselves in this situation and that the timing is bad. But I think that going down this path is going to create more problems than it solves. And I think we're going to get in a big, big mess here. And we're going to have people relying on us and relying on the system to work, and it may not work. So my recommendation is that we stay with the system that we have right now, have people do it by paper if they feel comfortable. If they don't, they can wait till next year. And for the charter folks, they have until August to collect the signatures anyway.
Okay, and then I've got Junie, Aaron, and Mark.
Thank you. I find Bob's speech slightly irresponsible speak because if we still have a stay-at-home order, I don't think it's right to say to people, go to the park, have a table, and have people congregate. So I don't agree with that. But of course, you've made some valid points. One thing I wanted to know maybe from Tom is, has he polled the committees, and would they be willing to figure out another way? Does that make sense?
What do you mean by another way?
Meaning, because we're talking about paper, would they be able to figure it out within the time frame?
I have not spoken to anybody about doing paper. I met with 2 of the committees. I offered to meet with all 3 that existed before today. And we talked about various ways to do it electronically.
Would you consider reaching out to them and find out? Then we'll be able to put it to rest whether they would be willing to go out there and figure this process out on their own through paper.
Of course, but yeah, I suspect we know what their answer is going to be.
Yes, and I think the comments I wanted to make is that we should not require a higher threshold. Anything we're not doing for paper ballots, we should not be doing for electronic ballots, because I feel that we're adding extra barriers. So if we're going through the online petitioning process, we should make it accessible to people, meaning that when it comes to publishing people's names, if we don't do that with paper ballots, we should not be doing that for electronic ballots either. And also, I think Rachel mentioned, giving people the opportunity to cure. I think that's a great idea. If, for instance, someone didn't meet the threshold, we should be able to give them maybe 48 hours or something to meet that threshold so that they can. I just don't want it to be whereas we said, yes, let's do this process, let's do the online signatures, and then we put so many barriers in place to the point it's almost like we're saying no, we're not really saying yes. So I think it's very important, if we're going to say yes, that we have a process in place that is accessible, because I think Rachel mentioned equity, and it's very important that we take into account these things. I know we're gonna have a reading of the ordinance next week. Something that I noticed was the lack of time frame, which I mentioned to Tom already, meaning that if you are contacting people through emails, when do you want them to get back to you? Within 48 hours, within a week? When do you want them to get back to you? So I think that's important. But it's hard. This is not easy. This is a really, really hard time. And yes, it's part of the democratic process. And people care about these issues, and we care about the community, so we have to find a solution. But part of the solution that we have to find out, we can't be cruel either. We can't say to people, go out there in the park and try to get signatures when we know we have a stay-at-home order. Thanks.
I've got Aaron and Mark.
Great. Well, I'll basically echo the comments that Junie and Rachel have made. I thought they raised excellent points. I'll just make a couple of additional ones. Just that I think the idea here is that, that COVID has interfered with this process of direct democracy. And we have it within our power to give an alternate approach that would allow direct democracy to still have an opportunity this year. So without weighing in on any of the merits of any of the petitions, it just feels like since we can still allow that to proceed this year, we should give it a shot. And just that the kind of the worst case scenario is that something makes it on the ballot that, the possible outcome is that something makes it on the ballot and it still has to be voted in by the voters. So it's not like any of these things would be passed just by the petition collecting process. So rather than repeat all the other points, I'll just leave it at that.
Okay, Mark?
Yeah, I'm going to have to go with Bob on this. I think we want to get to a system of electronic balloting, but not under these conditions, not on a jury-rigged emergency basis where we don't know if it's going to work. We don't know if it's going to be secure. We don't know if it's going to be secure from fraud. Those are just unreasonable expectations to try to fulfill in this in a 2-week period of time. I'm very uncomfortable with the direction that this is heading. I understand the disadvantage that this creates for various ballot measures, but a system that is going to lead to litigation or a questionable result is no bonus for anybody. And so I'm going to have to stand with Bob on this one.
Okay, Mary, and then Mirabai.
I think there's a reason that the online petition systems use two-factor authentication, because they've gone through probably the process that we're going through right now and determined that that is the safest way to do this. I have to agree with Bob that and Mark that we're jury rigging this, and it's at best it's going to be questionable, and it makes me quite uncomfortable. And the alternative could be to come up with some a framework for folks to do paper ballots in a physically distanced and safe manner.
Great, Mirabai.
I'll just keep it short and say that I really thank you, Bob. You said very eloquently many of the fears that I couldn't quite sum up as nicely as you did, but I do think in a time like this where we're trying to conserve our resources, putting ourselves out on something that's just not strong enough for me, a little faulty, and opening ourselves up to possibly expensive litigation is not the smartest thing. So I think keeping it the same way that we have in the past and just trying to figure out some workarounds. I think Boulder, as we always say, we're special and we know how to do things in a leading manner. So I'm sure that the great minds of Boulder can come up with some workarounds for this. So I will be standing with Mary, Mark, and Bob at the moment.
Adam.
Yeah, so there's two aspects of this that make me uncomfortable. The first, that we lose a little bit of democracy by not trying to find a solution. Actually, there's three parts that make me uncomfortable. The second part is not having an abundance of caution for petition signing. We're supposed to be setting an example in this instance, and I do worry about the sentiment that we're saying, not that democracy isn't essential, but that you have to leave your house to go do something at this time when we're saying that shouldn't be the case. The third thing that makes me uncomfortable is the fact that if this does happen under not perfect circumstances, that it is legally not justifiable. So in my mind, we have to take all those things into account and try to come up with the best solution, because any of them could break the system, essentially. So to me, I really would like to find a way to make it not health hazardous and hopefully stand up at the end of the day if things get on the ballot through electronic petitioning. I think we're capable of finding that, and I would hope that we are, but yeah, I'm somewhere in the middle here between the two ideas for sure. And I'm hoping we can try to find an agreement that actually still allows us to maintain direct democracy this year, but in a way that's actually going to stand up at the end of the day.
I'm not sure what you said. We have to vote at the end of the day here, and because this is a first reading, right, Tom? We have to vote to advance this. So you're going to have to.
Okay. Well, to me, then I would still like to try to find an electronic petitioning possibility.
Okay. That puts me in an unfortunate situation because I kind of feel like Adam. I don't want people going out and trying to do it by signature, but I also really am uncomfortable with every single thing I've heard about how on earth we're going to do this in a way that comports with the normal standards that we have for signatures to be validated. So in other words, we are taking the time we're taking, and we have said we're going to roll this out for the 2021 election. And we've always kind of said that, and we've always kind of had that as the reason we're going to do that. And Aaron argued for this eloquently, is you don't want to rush it. You don't want to just, grab the first free software group that you can to be able to throw something together and then have that gained. I mean, that's one of the reasons that at the end of the day, when you do voting, most of the voter security people talk about having a paper trail, right? So you do your voting, and it may be electronically, but you get some kind of paper record so that you can go back and check. And so I have not yet heard any way of both fraud prevention and validating who it was that signed that, because we've got the electronic signatures, as Tom has pointed out, is this very broad definition under Colorado law. And so as much as I want to preserve direct democracy, I don't see anything that's here in front of us that has to get done this year. I mean, the subjects of these are not things that I think are imminent. There's nothing about what's going to happen to Boulder over the next year that's going to be resolved by whether one of these passes or doesn't pass. So I don't think I can support this right now, just because I don't think in a week, 1 week, we're talking about taking 1 week, more or less, to design a electronic signature collection system that we previously said is going to take us 18 months to get done. So I don't think I can support this. So I think to be formal about this, we need to take a vote. We've all said our piece. So I guess I would say all those in favor, raise your hand and I'll count.
Can we be, I mean, we probably need a motion, don't we?
Yeah, we do.
Actually, I
So
can throw.
Introduce, published by title only, and pass on first reading.
Sure. So we need a motion. Does somebody want to make a motion?
I'll go ahead if that's all right.
Sure.
I'll go ahead and move that we adopt, with the language Tom just used, the ordinance as he amended it in his presentation tonight.
Is there a second?
Second.
Okay, we have a motion and a second. All in favor? Just raise your hand, I can count. So I count 4. Opposed?
I'm raising my hand, Sam.
Okay, that's 5. So the motion fails 4-5.
Thank you for taking the time to do this. I know it was hard late at night. I appreciate your attention.
So is that the end of our agenda? I believe it is.
Actually,
the work plan, right? The work plan.
But we don't need to do the work plan tonight. We could save that.
Okay. It is 11:17. Mary, you have something?
Yeah, I have a suggestion about the work plan. I think that needs to be an agenda item earlier in the evening. I actually think that it needs to rise to the level of a mid-year retreat or something, or an earlier retreat or something, or a do-over retreat. I don't know what you want to call it, but I think it needs to rise to the level of where we dedicate, at the very minimum, a couple of hours, at the very minimum. Because I think that circumstances have significantly impacted what we had talked about at our retreat earlier, and even what we planned on talking about at our retreat in July, I guess it was going to be, when we came back and revisited it. So that would be my suggestion.
I'm going to agree with Mary. We probably need a couple of hours, or at least an hour and a half, to go through our entire work plan, not just the next couple, 2-3 meetings, but the entire work plan, and figure out what's going to stay on for this year and what's going to move off. We actually found a little bit of time on, not next week is out of the question. We've got a very, very full agenda next week on some pretty important topics on budget and finance. But we have found some time on our agendas the first couple, 2-3 meetings in May. So I'm going to support Mary's suggestion. We know what we're going to do next week. We know what we're going to do the week after, and let's have CAC find an hour and a half or 2 hours on one of our upcoming May meetings to have a little mini retreat on work plan.
Okay. Anyone else comments on work plan? Okay, and Jane, are you comfortable with what you heard about that we can work with CAC to see if we can make a big enough time slot to put that in?
Yes.
Okay, good enough. Okay, I think that is the end of our agenda. Meeting debrief. Anyone want to speak about how the meeting went?
Long, but good. Thank you for running it.
Yeah, it's my worst performance so far in that regard, right? So, okay, with that, the meeting is adjourned. Have a good night, everyone.
Good night.
Thank you. Good night.
Live from Paris en France 24.
In other words, 4 branches of equal length that revolve around a central axis, formed by this double helix staircase. This design means you can walk up from 2 different entry points and never meet before reaching the top. And it's Leonardo da Vinci who suggests